Good morning, everybody. This meeting is now called to order at 9:02, and we will begin with a moment of silence, silent reflection, or silent prayer. Thank you. Supervisor Elliott, will you lead us in the Pledge of Allegiance this morning?
Please rise. I pledge allegiance to the flag of the Republic for which it stands.
Thank you. For the record, this is the board meeting of May 19th, 2020. Will the clerk please call the roll?
Supervisor Villapudua?
Present.
Supervisor Patty?
Present.
Supervisor Wynn?
Here.
Supervisor Elliott?
Here.
And Chair Miller?
Here. Thank you. First up this morning are recognitions and presentations. And we are scheduled to receive a winter shelter group oral report by United Way of San Joaquin. And appearing here to speak to the board today, I believe is going to be Kristen Spraker-Burtwhistle, President, CEO of United Way, and Tori Verber-Salazar, San Joaquin County District Attorney. And are we going to have additional speakers telephonically this morning or not?
Madam Chair, I do believe that we have a host of speakers that are available telephonically. Kristen and Tori Verber-Salazar will be doing the presentation, and if there's any questions or any additional information from the speakers, they'll be able to present as well.
Great. Thank you so much.
Wonderful. We did not expect to be so early. So. Good morning, everyone. This is a nice surprise.
You're right out of the gate.
That's very true. Well, again, by way of introduction, my name is Kristen Spraker-Burtwhistle.
Right here, right?
The United Way of San Joaquin County is their president and CEO. And I'm here today to talk about the emergency winter shelter. And I first want to thank, again, the Board of Supervisors for your time today. We hope that our sharing of our report findings regarding the Emergency Winter Shelter Project, sponsored in large part by the generous funding of the County Board of Supervisors, will answer any and all questions you have about this great experiment in terms of giving us honest feedback while leading to possible discussion around replication, sustainability, alignment with the larger county strategic plan being created by Home Base, and lastly, a perceived new lens on how we might draw on these insights, frankly, for future planning. So here's one caveat for today. Please know that the winter plan was never a perfect plan, but as we will quote in the back of our slides, an imperfect plan now is better than a perfect plan never. So we ask for your forgiveness in many cases if our report or experience actually falls short. We actually had less than 2 months to plan before we were launched. So let's just call this a pilot. We also must note that an unexpected deviation actually occurred during the implementation of that winter plan, and that pivot was to manage a response called COVID-19. We were fortunate that our subcommittee had the talent and expertise to mobilize in support of our shelters with partners from the county, the city, and the COC. And our committee also helped support Project Room Key as well, and we'll be expanding on both of these later in our presentation. But first, I want to offer thanks to two groups of people. Those of you here today in front of me, and those who are sheltering in place and hopefully listening somewhere in the air via Zoom. Without you and without the members of the subcommittee, this plan would have never, ever been possible. First of all, again, Vice Chair Supervisor Miller, I want to thank you for your early lead, very early lead on the development of the Homelessness Task Force. It takes a pioneer to discover the land, and we are thankful for your early intervention. You started us all on the right path. And to Supervisor, I want to say it Villapoudois, I like to say it in French style, for your steady and quiet support of our subcommittee from day one. You have helped sway others to the value of this group and have given us the expertise and consultative support of our famous, I call co-chair, Chris Ruppe. As a co-chair, he has provided us with research, with ideas, with data, and logical thinking. And to Supervisor Patty, thank you so much. You are one of the greatest cheerleaders that we've always appreciated, again, your insistence of doing more, doing what's right for those who are homeless, even if we disagreed with you sometimes. And to Supervisors Elliott, Wynn, and County Administrator Monica Nino, we thank you for your belief in our plan and advancing funding to our cause. Okay. Yeah. Right. So we are here today on behalf of the Emergency Shelter Subcommittee, a total of 47 active members, subject matter experts, COC board members, elected officials, and most importantly, our tremendous shelter leaders who I hope are on the call. They allowed us to become a part of their shelter families during this time of winter plan and coordination. So I want to give a thanks to those shelter leaders, Wayne Richardson and Britton Kimball of the Gospel Center Rescue Mission, Jolynn McMillan of the Stockton Shelter for the Homeless, and Edward Figueroa from St. Mary's Dining Room. Thanks to these leaders and this committee for being such a galvanizing and incredible source of strength, and to the San Joaquin County Data Cooperative, whose analytical support gave us insights each month as they developed status reports and the eventual document that we hope you have read from cover to cover in front of you. So thank you, Cameron Bullock and Natalie Garcia. And for the purposes of today's presentation, Tori Verber-Salazar, our dedicated district attorney, whose actions every day demonstrate her commitment to our most vulnerable populations, will share and discuss our successes and challenges from the winter plan. And Phyllis Grupe, a staunch community advocate who has provided us with wide-reaching insights into the importance of prevention and the value of upstream, not downstream thinking, will offer her thoughts on this process. So we also hope that the detailed 12-page report might answer any questions you have in respect to our process, our outcome, data, and significant findings. And in the end, we hope the Board of Supervisors, your insights in particular on this work, will help us explore how to replicate on a countywide basis and candidly provide us with your own perspectives, and we would like to share our recommendations at the end as well. So I want to start by actually giving you a brief introduction. So how did all of this get started? The Winter Planning Committee, the idea, how did a group of well-intended people sit down and determine a point of intervention? With the growth of the unsheltered population, many being a high-risk population, the shelters could not sustain everyone during the coldest months of the year. Even worse, that men, women, and children might be turned away from shelter, and when weather was at its worst. It really was the perfect storm in a lot of ways. From that point forward, a small cohort of that committee began to meet and initiate discussion about a winter plan that would do two things: expand the bed capacity, expand space, if only modular, expand mental health and wraparound services, and seek financial and fiscal support to operationalize services to 100 added guests, primarily men, at both shelters. The group began to meet weekly to study other models of winter planning across the country, to speak with key stakeholders in our shelters, behavioral health, our nonprofit sectors, builders, law enforcement, and more. Very quickly, a detailed plan with a focus on collective capacity building was created. It included a common agenda, a shared measurement structure, mutually reinforcing activities, continuous communication, and a presence of a backbone organization, which was United Way at that time. The two shelters that were selected as part of this pilot were the Gospel Center Rescue Mission and the Stockton Shelter for the Homeless. Both have traditionally been the largest providers of low-barrier sheltering, food, clothing, and treatment within the county. Combined, they have over 100 years of collective experience in serving those with less. While both have uniquely different missions, both had an interest in supporting the winter plan. Both had the ability to expand in place given funding and support, and each was willing to dedicate staff to the experiment. One of the most significant alliances in our winter plan included St. Mary's Dining Room and the staff from Whole Person Care and the San Joaquin County Behavioral Health Departments. St. Mary's provided food, essential services to those experiencing homelessness. Edward and Jolynn, again, the shelter leaders enjoyed a tremendous partnership, and together they projected food costs, needs, and the intent to operationalize for a much higher population of clients. While the detail in our report signifies so much more than I could ever share, Whole Person Care and Behavioral Health dedicated staff, added staff, I mind you, to connect homeless clients facing serious issues to providers and services around substance abuse and mental health resources. They also used a shared data platform to track and monitor guests who entered into the shelter program. And lastly, the Community Partnership for Families of San Joaquin County also provided case management at our winter shelters, and they help with wraparound services and navigation, goal setting, and more. Before I turn this next section over to our data colleagues, or to Tori, I want the Board of Supervisors to know that, again, this experience was as much about leadership as it was about a winter plan. Everyone contributed. Everyone took action. Every person gave of themselves to ensure the success of this initiative, and they kept on going. So one of my favorite quotes is from Margaret Mead, who says, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." So this group, in fact, has truly, again, changed our community for the better. Now what I'd like to do is turn this over, and I don't know if he's actually on the call or if Tori would like to do this section. Oh, there you are. There we go.
Sure, I'll jump in.
All right, go ahead,
Thank you. Thank you so very much for the opportunity to be here. And we wanted to talk about the cumulative effects and what we learned from this journey from December 1st of 2019 until March 31st. During that time, 560 unduplicated or unique, as they're termed in the HMIS system, guests were served at the two facilities that we primarily focus on, St. Mary's Stockton Shelter and the Gospel Center. They are the largest in the county, and we felt that this was a good testing opportunity for us to get a snapshot of what we're really looking at with the homeless population. So at that time, we did have the capability of connecting. Some of these individuals had been in the system prior to. We had lost, either they were transient or moving to different locations and came back, or we were just unable to connect with them. And that's probably the most positive outcome of this journey, was the ability to connect 560 individuals who are unduplicated guests that are served on a daily basis with services. And that includes Whole Person Care, San Joaquin County Behavioral Health Services, community partnerships, as well as all the wraparound CBOs that support the unsheltered. We did a survey of these individuals, and this is self-reporting, so this is, data can be subject to a number of things. 76.8% reported zero income in their household, 7.5% were veterans, 30% plus, almost 31% were experienced chronic homeless, meaning they had been in homeless need of services over the last 12 months, and 43.5% were homeless for more than 12 months in the past 3 years. And we wanted to kind of get a snapshot of what we were dealing with. Are these individuals chronic homeless? Are they long-term? And now being at the shelter and out on the street most days, we're seeing individuals who have been homeless for the past 12 months and those who have been homeless for up to 20 years that are continually coming to the shelter. So it's a wide-ranging bit of information and data, and I think that there's an opportunity here to mine this even further to really get an understanding of what we're dealing with out there on the street. We can go to the next slide. So we looked at that and said, what are we dealing with? What are the key issues that we need to address in order to assist in people from unsheltered to sheltered housing? to almost 30% are substance use disorder. And again, this is self-reporting. So there is, we weren't testing and screening individuals for it, but this is their reporting. 27.7%, 19, nearly almost 20% admitted to mental health. 18.5% with physical disabilities and 13% chronic health conditions, and about just over 4% with developmental disabilities. And so that tells a story a little bit too about what are the primary needs and resources and wraparound services that we're going to need in order to lift these individuals up and get them into sheltered housing and have a sustainable, healthy life going forward. And that allowed us to really focus on those needs. And getting services in there and create and plan our strategic plan going forward in order to support individuals with those services. Now, I'm out on the street most nights with Chris Rupe, who's done an outstanding job, and a whole team of, we have Animal Protection League, Dennis Butner from BHS, and Chris Rupe, Rima Barquette cooks all the food for us. And so we do screening, connected to services, and we also do animal rescue and assistance with the animals. In that, these numbers would probably be a little low, in my estimation. I would say the use of substance abuse disorder would be higher. Mental health would be a little bit higher as well. Physical disabilities is probably right in the range. Chronic health would probably be a little bit higher as well. And developmental disabilities would be actually, I think, a little bit higher. But it did give us a good snapshot of what we are dealing with and the complex issues we have and how we can provide those services. The next thing we looked at was the daily census count. And that's just here to give you an idea of what they're dealing with on a regular basis and who's coming in and who's coming out. And lastly, we wanted to talk a little bit about some of the successes that we've seen in this, and the challenges that we've also seen. As you know, this is a very complex, in-depth, challenging issue. We secured the funding for the shelters, which was great because, like we said, we started in October and we were operational in December, and that's record-breaking time for cities and counties. And we did services and resources, that connectivity, having whole person care, behavioral health there, San Joaquin County clinics there, CMCs there now, all allowed us to start getting people on the track to wellness and getting them healthy. We know right now that we don't have the housing to put them in. We can't just pick up the phone and call and say, give me a house, let's put them in there, or an apartment. So we have to work within this emergency shelter and this circumstance that we have in order to bolster people, get them healthier and get them well. And when that housing does become available in the near future, we'll be able to transition them and I believe in a more successful way. We became much more educated on what the plight of the homeless is. Often we sit in these meetings and talk, but when you spend all day and all evening with the homeless, you learn a great deal about what are the resources they need. And so that gave us that incredible insight. And then the thing that happened, because the committee was so, this is a committee that powers through and just doesn't take no for an answer. It's one of the most energized committees I have the privilege of serving on. We were able to pivot when COVID-19 came and allowed us to really focus. And so we haven't been focusing so much on the winter shelter. We've converted all of our energy into COVID, and that includes a number of things, Project Room Key, outreach in the evenings, outreach during the day, food, shelter, clothing, you name it, we've become engaged with it. So the challenges we saw was reporting and messaging this. How do you message this whole subject? How do you educate the public about what we're seeing out there? We know that we did about 200 people from the Stockton shelter. 75% of them were seniors, and many in bad health, and many have been transitioned to Project Room Key. But we know we have a substantial senior community out there that is not being addressed, and we need to bolster those wraparound services for them as well. We also know we have children out there. We have found, and I have personally been with several families that are out there. We should never, ever, as a community, tolerate children living in a shack in a canal with no electricity or water, dirt for a floor, and a blue tarp for a roof. That should not be occurring. So we saw that as a significant challenge on how do we get these families to come back in, how do we get them into shelter, and how do we find those resources for them. We found that really looking at the long-range plan, and we're working with COC and Home Base to create and develop that plan for what is our long-term plan for this to accommodate those who are unsheltered and get them into stabilized services. And we found that those opportunities really challenges were things that I believe we've corrected or we can continue to correct. And so I didn't find that they were insurmountable. I just found that we need to have a better pathway. And I think we can't rely on doing things the way we've always done them because we can't validate that they were successful. What we need to do is look at each step and evaluate it appropriately and determine whether or not it is a viable, functioning service that we're providing to the community. And if not, how can we bolster it and make it as such? So we did the year to date. And last year, based on HMIS data from 1819, 974 were served, 1,055 this year during that period of an increase of 81, which is good because we had asked for 100 beds. So we were hitting about that 81% mark. Again, we lost about 2 weeks at the Gospel Center due to a sewage flooding issue. And then we, of course, had some struggles with COVID because we were trying to limit the people coming in order to keep the staff at Gospel Center and Stockton Shelter as well as possible. But we were pleased to see that we saw that 81% increase, and we felt it was effective. So what we highlighted was some of the summary of the highlights was having this mobile committee and very fluid committee in place allowed for a highly effective emergency response to the expand shelter capabilities, which was good. We know that Stockton is taking in about 200, anywhere from 175 to 220 a night, and having that additional 50 beds allowed them to expand. We know there's plenty of need out there, so that really created that opportunity for them and for the gospel, and I have to give them both incredible credit. They took on these additional 50 individuals and did so with very little funding to support the additional personnel that they needed. They achieved success and worked, effectively to expand the shelter, food, hygiene, case management services to vulnerable individuals, and that is critical. Not only were we able to connect them and put them back into the system, we're able to track them better, we're able to connect them with services, and that was a key component. Probably the most successful thing of this was the ability to connect them to services and get them back engaged in the wraparound services that we provide through our community-based organizations and through the county. So that was a big plus. And then we pivoted to COVID, and that continues to be putting people at risk for infection and loss of life. We have been testing out there for several weeks now, probably 3 weeks. We've been screening for 8 weeks, educating, empowering, providing resources, backpack, hygiene kits, new tents, sleeping bags, things of that nature to clean out the clutter of the old and put in new mechanisms to keep people healthy and well. We've done, I think, over 215 tests between the staff at communities at Stockton Shelter, St. Mary's Dining Hall, and the Gospel, and their clients. And we've done pop-up testing out in the canals and on the street. Of those 217 tests, I have not had one positive yet. So we are working hard to establish the safety and well-being of the individuals. We'll be testing again all this week, next week, and the following week. And I want to thank the hospital, San Joaquin County Hospital, and the San Joaquin County Clinic and Joan for that work. What we've done since COVID is to work to decrease the imminent threat of the spread of the virus and support the reopening of the economy. I think it is critical that we focused on the homeless from the very beginning, and people have asked this question. It's because we knew that they would be a factor in our ability to open up the economy, and we needed to have the data to support that we are strong, we are healthy, and that we were aggressive and progressive in our approach in dealing with the unsheltered that allowed us to verify that they are moving in the right direction. And we thought that was critical to making sure that everybody was safe and well and healthy, but also the subpart of that is getting this economy back up and getting people working. So we were able to fast-track donations of essential supplies. We have 1,600 backpacks that we've given out with hygiene kits, socks, towels, COVID-19 training. We screen several, probably about 300 to 350 a day, 200 plus at the shelter, and then probably another 50 to 100 at the Gospel. And then Monday, Wednesday, Thursday, and Friday, Dennis Buettner, Chris Rope, myself, go out to, and Adriana go out to the street and do another 100, 120 screenings. So we're getting several hundred people a day, upwards to 500 a day, working with them to educate and empower them. That also, because of this committee, we had that flexibility and that mobility to bring those resources together and work collaboratively with county agencies and community-based organizations to get out there and get that information, as well as Ed Rodriguez from my office, an investigator, go out every night. So we partnered with Room Key. Casey Rain from my office was critical player in this. We also did support services in that team members worked remotely and documented every step of the way. That was tremendous leadership with Chris Wood and Dave Tolliver and Marcia Cunningham in pulling that together. They deserve a tremendous amount of credit, as well as all the team members at HSA, Behavior Health, Tony, Francis, and Betsy. Amazing work what they were all able to pull together and get the Room Key project up and running. And we did supportive services and supported them along the way in the journey, but their leadership should really be recognized. So from that, we were able to kind of respond on a street level with our partnering agencies and community-based organizations and really get a fast-track opportunity. And then the last thing, we alignment with the San Joaquin County Strategic Plan. And that was to educate and engage the community, expand low-barrier shelter, which we have to do, and capacity hours and services, and then invest in prevention. And those were really the three critical thresholds we were able to make. And so with that, we'll open it up to any questions.
Yeah, we'd like to open up some questions, and I'm not sure who's actually on the call right now. So if I'm expecting to hear something over the airwaves here, but if anybody actually on the call who's a member of the committee who's been asked to join us wants to make any comment, I don't know if Wayne or Jolynn or Edward are on the call. Okay, gotcha. Okay. And then we'll close. We'll have Phyllis Groupie make some suggestions and final recommendations. But I would like to, as people are starting to come in, to thank Tori. She's done a tremendous job, and really, I think, directing. She's been sort of our, I like to say, backbone, our voice, our strength in pushing this forward in a lot of ways. The response to COVID was in large part, certainly due to the committee, but to her advocacy and being out in the encampments. And I don't think any county can actually report they have, at this point in time, based on measurable tests, 0, again, COVID positive homeless clients. We also tested initially the entire staff as well, and they are COVID negative as well. Okay. In the meantime,
Questions?
Wayne Richardson.
Wayne Richardson, are you on the line?
Yes, I'm here. Can you hear me?
Yes, we can, Wayne.
I just want to thank the Board of Supervisors for the funding early on, the commitments that really made this possible through the, starting with the winter shelter, and this is on behalf of Jolynn, Edward, and myself, that really got this ball rolling with the city. It's been an amazing response of nonprofit and city and county effort and United Way. It's something we hope that we'll be able to expand upon for the future and really develop the momentum that has been established by this amazing committee that has come together and really addressing the homeless situation. So thank you so much to the Board of Supervisors and the staff, the county staff that's been involved, Tori, her staff, behavioral health, as Kristen mentioned. So thank you so much.
Thank you, Wayne.
I don't know if John Mendelson is on the call either. That would be.
John Mendelson, are you on the call?
Hi, yes I am. Can you hear me?
He has a newborn.
Hey, John.
Yep. 9:30 a.m. feeding. So, yeah, actually, just to add a couple of things. First of all, really want to thank everybody who's been doing hard work as part of the committee. I think that one of the biggest successes to come out of this effort is the expansion of the capacity of our system insofar as that there are people who are willing to do hard work and to get that work done quickly. And I really want to point out that it's the folks at Gospel Center Rescue Mission and Stockton Shelter who I believe deserve a lot of credit, because whether they get additional funding or not, they are constantly working with the homeless, trying to get them off the streets, connected to services, into permanent housing, which is always the ultimate goal when we're talking about a response to homelessness. And so from our perspective, we just really want to thank everybody who's done the work on the front lines. We are also going to try to provide an update regarding permanent housing during the same time period as soon as we can. And we look forward to distributing that to folks as soon as we get an opportunity. So thank you for letting me add to the report.
Thank you, John.
Open up to questions first.
Yes, please.
Are there any questions from the board? Supervisor Elliott.
Thank you, Chair. Yes, just as a follow-up to the statistic there that we've had 0 positive COVID-19 cases in the homeless community, I was curious, are we keeping them provided with personal protective equipment? What are we doing that is bringing that about?
Well, we don't have sufficient PPEs right now to do so. The senior population, we're trying to get gloves and masks to. The rest, we just don't have that kind of resource available. Now, they're starting to come in. Yesterday, we were at OES and picked up a number of things. But they're starting to come in. But right now, we're only able to really target that senior population and provide them. So very, very limited PPEs are being given out. Now, we are giving hygiene kits, hand sanitizer, and education. Staying 6 feet away, wash your hands. One thing about the unsheltered population is they do kind of social distance on their own, even though it looks like there's a lot, but they remain in their tents, they travel in smaller groups, and they're very aware of it. Many have such high-risk pre-existing health conditions as well that they're very, very conscientious of this disease. So when we first came out 8 weeks ago, a lot of the comments we received, our questions are, do you have a fever? Did you have a cough? Did heavy breathing or any of those things? A lot of them said, no, but I did months ago. And so it'll be interesting to see when we get to the antibodies test if we can do a pilot project out on the street and kind of get an idea of what we're dealing with here. But so far, I mean, statistically, sure, somebody's going to test positive. It's inevitable. But right now, the results are overwhelming and to us. And I think another valid tool that we can be using as justification to get people back working. So because we have a significant amount of people that are homeless right now, if we do not get this economy back up, we will be grateful for the days when we had 1,550.
And I want to add to that.
We need to really focus on this. And we're seeing a lot of people arriving now, living in the cars, which is that step before.
Right.
And so we're seeing a big spike in that. And we're seeing it in our parks, and we're seeing it in the areas that we're at. It's that last hold that they have, the ability to get to the grocery store, to get to a job interview, to get their kids to school as that vehicle. So we have definitely seen a spike of those returning back into the community.
And Supervisor Elliott, I wanted to add that in the shelters themselves, again, we mentioned that the staff, they have been required to mask per policy by both of the shelters and St. Mary's Dining Hall. They also, we were given an essential supplies budget from the city of Stockton to actually purchase masks, and so we've been trying to purchase as many masks as we can for the clients that are actually in both of the shelters. So, as Tori said, we can never really get enough, but public health also has been there doing some significant in-house training, and we have huge posters plastered everywhere around hand washing, social distancing, and masking. So we think that's sort of helped educate and keeping people safe.
The other thing I would say, too, Supervisor, I'd like to mention is that we have engaged with thousands of people. A lot of them are repetitive, but we engage, like I said, with several hundred every day. We have never been treated rudely, with disrespect, or had any concern for our personal safety or well-being. They have been very open, very honest, and very responsive, providing us with their name, correct date of birth, and allowing us that ability to start connecting them to services. So we're putting in more data into HMIS than I would estimate we've ever done before because of this outreach. Between the shelter and the gospel, who, God bless them, work every day, as well as the outreach that behavioral health. I want to thank them for the resources they've been allowing their teams to come out in the evening and work. And that really has allowed us that opportunity to engage one-on-one with them and see what's going on. I would say the number one thing is probably a close tie is substance abuse and mental health as to how we get people back up. But engaging with them, you'll find a lot of them had homes and lost them, or had an apartment and lost it, then moved to the vehicle and then moved to the encampments. So we really need to study that data and get more information from these individuals so that we can also provide that preventive arm. Because we could have, there's probably a good opportunity for us to learn from them how we could have kept them from getting to this point. Because once they're in the tent, they need everything we have to offer in order to pick them back up. And we have two people that we worked with that we interviewed quite a while ago in order for a video that we created. And over the 8 weeks that I've engaged with them, the rapid rate of deterioration is shocking. The longer they're out there, the harder this is going to be. And so we really need to look at how we can get people at least into a temporary shelter with wraparound services and support mechanisms until we can build the ability to get them into permanent housing. And so and that housing is going to be different. You're going to have an SMI population. You're going to have women and children. You're going to have those who are able-bodied and employable and can live and sustain independently. And then you're going to have those that are going to need some connectivity to our resources and capabilities. So I would highly recommend after COVID, you go with us in the evening. You can see, hear, and live it firsthand.
Thank you. Supervisor Wynn?
Thank you, Madam Chair. First of all, thank you for your efforts, Kristen and Chris. I know you've spent a lot of time and effort, and certainly Phyllis and our district attorney has expended a tremendous amount of time on this particular project. I got a couple of questions. One is, obviously, as Tori said, we had to pivot with Corona or COVID-19. But you've also mentioned several times in regards to the health of the individuals, obviously not just the physical health, but the mental health. And I think, one question is, based upon our experience and what we've been able to do collectively as a community, and certainly for all those who participated, what's the next chapter? Where do we go from here? But the other one, which is actually getting a lot of attention nationally, I heard a lot of people talk about this, is especially from those mental health experts, behavioral health experts, is the woeful lack of available treatment for these individuals who desperately need help, and until we can feed them, we can give them beds. We can give them temporary shelter. We can give a lot of things, but until we fix the root problem, we're just spinning our wheels, and we really don't help them out of that situation. So the first question is what's the next chapter continuing on with this? Especially with the beds that we provided, the 100 beds, and then, from here on out, what happens with those individuals who occupy those beds. But the second part is do we have enough additional information, because there's tons of it out there, to really lobby and try to pursue various types of funding mechanisms and training and all these things that we lack from psychiatrists and psych techs, et cetera. Do we have enough information to make a stronger case for expanding these services? Because without that, we're just, our numbers keep going up. We spend millions, if not billions of dollars, and we keep adding to the numbers. And so there's something wrong with the system that doesn't reduce the numbers, which we all try to do in every project that we work on. So just a general question as to how do we change this? Because without that help, I don't think we can make any significant headway. So, but you're in the front lines. I'm just listening to your presentation.
No, thank you, Supervisor Wynn. Great question, and I want to thank you. You and Denise have always been very supportive of us in this pursuit and finding resources and connecting us on the homeless, and I really appreciate your leadership. Two questions there. I think that we really need to evaluate what we are doing and determine what is working and what is not, and pivot from what is not working, and bolster what is and create a pathway that it is more successful. I think that we have to, the number one things, a couple of the top things we see out there when engaging with the public is they can't get into their Social Security is not maybe as correct as it should be. Dennis Buettner, who's on the homeless outreach team, knows all of this better than anybody. But the number one thing is, are they getting enough resources from HSA? Are they getting enough from veterans? Are they getting enough from Social Security? And are there other programs that they're available for connectivity that could help bolster their income? We put a woman in last week that was at the motel. She was running out of money. They reached out to me. And she gets $650 with 3 children. And one child is special needs and needs really an amount of care. Thank God Wayne had a space and took her in at the Gospel Center for us. But she also needs a recovery program because there's substance abuse. Now, to give you an idea, this woman who's the mother of these children, and I tell this story because it gives you a flash of how complex this is, was a child that we removed through CPS. Due to extreme abuse and neglect by her parents. She was then placed in another care facility, and there was abuse and neglect, and the child was removed again. Then as an adult, she aged out of the foster care system and then became a parent with absolutely no tools or resources to parent whatsoever. Never having a moment in her life where she had an example of what it meant to be a healthy, well-being mother or parent in this case. And then now has 3 children. And yes, there is responsibility. Why is she having 3 children? I'm sure people will ask that question. I'm a big advocate for free birth control for everybody. But the issue we have here is we have an individual that has multiple issues of past trauma, high ACE scores that are going to prohibit her growth ability, her ability to intellectualize and process forward, now responsible for 3 more children, all homeless. She had $650, she paid $550 for a week at the motel, leaving her $100 to feed her children for 4 weeks. There was no way that we could leave, that was going to be a successful plan. But she also doesn't want to deal with the addiction. So we've navigated that individual into coming into a facility to get those wraparound services and start that recovery. Where it gets difficult is when they refuse to do recovery. Now, we could pop them for possession, but that's not a long-term case where you're going to spend, a substantial amount of time. There's an opportunity to remove the children, but then we're putting children in placement and spending all the money and resources to do reunification to get them back together. So we're spending a ton of money on this and not always moving forward. And so I think we have to go back, and I'd like to do over the next few weeks as a pop-up and interview each person out there and really understand the data, really understand how many are and what their journey is and what their services are and what kind of services they would need to be, that we could support them. And then use our resources wisely to focus on that. And I think the other thing we make a mistake is like the individual that we dealt with the other day, he needed to go to Social Security, he needed to go to DMV, he needed to go to veterans, and he needed to go to HSA to get all those services. He's not going to do it. The mental capacity to do that, it won't happen. And so we need to go to them. So there should be pop-ups in the canals, and they should have that connectivity and that ability to do that instant connection. Dennis is usually on the phone trying to, and working the calls for us and does a great job trying to get them, but they usually want them to come in and be seen. That step isn't really working. So we need to look at that and figure out what is a better mechanism moving forward. So those are just kind of some examples where I see the gaps in services. It's much like our Family Justice Center. And speaking with Suzanne Schultz yesterday, we'd like to expand our Family Justice Center, include the homeless in it, because we are downtown. So we're looking at that possibility of how we can process that in order to support our community, because our job is public safety and healing, and we know we can't move forward if we don't lift everybody up. So we have that capability of doing those one-stop shopping wraparound services, but we're going to have to meet them in the street. And I think that's a big change that we have to make. I would love every evening to have somebody from all those agencies out there with me and have the connectivity through, their tablet or their to do that. And I'd love to have CBOs out there with us that can get them right then. Because it's also the difficulty is that if we say we're going to come back tomorrow and I'm going to bring you sometimes, like you said, things that aren't going to change the outcome, but things that they need, feminine hygiene products, hygiene kits, things like of that nature. I have to spend half the day looking for them to find them because they're moving, they're going, they're doing their recycling, they're doing that stuff. The other thing is when we're signing them up for the COVID testing, we're changing our process because we've learned from it, but originally we signed them up and then came back the next day. Well, we had about a 30% participation rate, because we couldn't find them, they moved, They were out working, whatever they were doing, and that wasn't driving the results. So I think we really need to look at understand our data, and then figure out how we can drive our resources, because we know we're going to have limited resources with the COVID consequences of the cost. So how do we make them most effective and efficient? You have tremendous leadership at HSA and behavior health and public health. They're all driving to try to get new ideas, and I think we need to drive that. And I think we also have to focus on this section, because I cannot say I'm going to put you in housing, because there is no housing available. So I want permanent housing, because we know we can be wildly successful if we get them into permanent housing, but those are coming in phases over the next probably 1 to 5 years, and until we do, we have to address this group. And that is by wraparound services, employment. We do a lot of work cleaning people's criminal histories up. We had a woman who was a victim of human trafficking, and she's doing excellent. She's in the business class. She did parenting classes. Her children were returned to her. She's doing really well. She qualified for a great apartment in the South County, and she has 1 prior eviction and 2 prostitution arrests, 1 out of Arizona and 1 out of another state. So I don't have jurisdiction over those cases. And those kept her from getting housing. Without housing, you know where she's going. It's all going to go back downhill. So we were able, thank goodness, to the 2 states that cooperated with us to pull those warrants for us and take care of it. And then we worked on doing a steady payment over. Carol Nellis taught us a good trick on how to get you a steady payment to build your credibility and your credit in order to get in, and we got her into the apartment. But that's the kind of work it takes to get these people stabilized. If we didn't, she would deteriorate to her car, to the street, and we would have children being raised to be homeless. So you're right, Supervisor, right on the point. What we're doing is a Band-Aid, and we're doing it primarily to prevent COVID spread. That's really what we were out there to do, is educate and empower. And then we saw more needs, and as we saw more needs, we provided. And we provided the food to prevent the migration so that people were not going all over town. We wanted you to stay in place. And so we guaranteed them the food to keep them in that place. So I agree. I think an overhaul of what we're doing and how we're doing it and how effectively we're doing it, because this is probably one of the biggest issues we'll be facing, and the likelihood of it to grow. And I'm going to let Phyllis jump in from the CBO perspective.
Let me just add a brief comment before, Phyllis. I look forward to hearing from you. But you touched upon an area that we may be having, and I know Phyllis works, daily with this. We have 3 potential candidates to go the same route. We're going to triple the problem with her children. We need to fund organizations that work with families to prevent those 3 from becoming the same as their mother. And that's really what we need to focus on. Jane Musolimus and I have talked about this, is if we can start educating and supporting young children, even preschool children, all the way through, to give them, I guess, a sense of what reality should be as opposed to what they're experiencing on a daily life. I think that's really the key. And funding organizations like Phyllis's and others that can step in and provide those children with something to look forward to, I think is a real step in the right direction, as opposed to allowing them to become 18, 20 years old with their 3 children. And we just keep multiplying the problem when in fact we should be dealing with at the early stages.
And it's complex. We had this conversation last night, and we put in, and Chris Ruppe, thank you, Supervisor Phillip, we have completely kidnapped him. We will return him at some point. No. Yeah, no, never. Good point. But Chris is got to be one of the kindest souls that I've ever had the privilege of working with. We had a family, and the first night we arrived, 2 families, 1 on each side in the slough, and they call it the trenches. And one was living in an abandoned van and an abandoned trailer, and the other was living in a shack. And these children came out, and we set up our table, and we started our COVID training and our screening, and they came out and were so loving and wanted to help. And they served food for us. We put them in gloves and PPEs, and they served food for us. And I thought, this is a message from above, that these children were so joyous and so full of hope, and they were living in unimaginable circumstances, and in the United States of America. And I thought, like you said, here is this joy. They were just kids, and all they wanted to do was be kids. And we see them, and we are not providing that pathway for them to be in a better place. And that's not who we are. And so we were fortunate to get one family into. The other family is very reluctant to come in. The one family we did get in managed 72 hours, and then the mother wanted to get high. So and I don't tell this story to belittle anybody or to shame anybody. It's out there. And addiction is in every family in America, is my belief. But it tells the story of how difficult it is for us to fight meth. Meth is a beast. It makes COVID look like a walk in the park. I mean, it is a very destructive drug, and you and I have worked meth cases for many, many years. So we're struggling with how do we fix that? Where do we put? Do we take the children and how do we process that forward? And where can we put them in a safe environment? And how can we get her wraparound services? There's some rules out there that some of the services can't take her. She has a 16-year-old autistic child. Some of the groups can't take children that old. Things like that we're learning. And so we really need to look and find how we can place these women and children in facilities that have wraparound services and get these kids out. We've seen these children since March. There has never been a moment that they were getting educated from a school system. So there's also now they're a year behind, and probably because of the transient nature, I would be surprised if they went to school at all this year. So, like you said, we're turning 1 to 4 like that. And that's what we see. A lot of the kids, especially the young people that are 18, 19, 20, they're disabled and their family was able to collect those resources but when they're 18, they're aged out and then they're turned out to the street. So there's some very heartbreaking stories. There's a gentleman that I know quite well who had a rough journey, lost everything, and works all day and sleeps at the shelter every night. So the stories are across the board of what we're seeing. But I would say about 20% of them could get up and running if we could get them in stabilized housing. That 30 to 40% are going to need some assistance from government and private and public and CBOs. And then there's about 20% that are seriously mentally ill and really are going to have full-time wraparound services. So we have to also look at, as we're building this housing, how and what that looks like. And Tony and Francis and Betsy over just have some really cool plans for that seriously mentally ill. Those should be up and running. I don't want to speak for them, but my understanding is summer, fall. They've had some really outside-the-box approaches to that, and I think it's going to help us a lot. And then Carol Nellis is, building as fast as she can. Group of companies working with us to build as fast as we can. And there's a lot of great projects. And the county, the South and North counties have done an outstanding job. I mean, we work with Lodi a lot, and they've done an outstanding job. And so is Manteca and Tracy, Ribbon and Escalon. So we'll continue to work.
Kathy, Board of Supervisors, thank you so much for allowing us to come and present this journey that we have been on. And these young women that I'm working with is such a privilege for me. Kristen as my babysitter when
the babysitter kids.
Yep. And Tori, I've known since she was a little girl, and her mom involved in the Parks and Recs, and people that have committed to this community and have stayed in this community when they could have gone elsewhere. And all of you on the Board of Supervisors as well have committed to this community, and it's a testimony to the great leadership in this community. So I thank all of you. We've gone through so much. You've really heard the story, which is very poignant, touching, and demanding at the same time. When we closed our mental health facilities in San Joaquin County, there were about 5,000 people at that juncture that were being taken care of one day. The next day they were on the street to take care of themselves. And that was a choice that was made because it was very expensive to keep them housed, but yet it's we believe, more expensive not to have the care for them. But now we have laws and we have barriers that are keeping us from really helping many of these people. And so we need to work on whether it's lobbying, whether it's electing officials who will support that, working with Tori to help her get the tools that she needs so that she can bring these people in, and then working to get a facility where we can actually bring these people in. And I have high hopes that there are some things that are going to be happening in the future, the near future, that will make that come to fruition. But it's going to take a great deal of trust from all of you, from all of us, with each other. And as Kristen said earlier, an imperfect plan now is better than a perfect plan never. And we know that we're going to have to take some leaps of faith. We're going to be making some mistakes, and we're going to be making some wonderful decisions. We're going to be finding out a lot of information that Tori and Chris and Dennis Buettner have been out on the streets, finding out information that we wouldn't have had otherwise. I don't know of any other county that has the DA who's out on the streets 3 nights a week dealing with the homeless, trying to find out what is going on and what we can do about it. Prevention, I agree with you, Supervisor Wynn. Prevention is the key element. Community Partnership for Families works with about 15,000 families a year. Those families are on the edge of homelessness. Although I don't know anybody personally who has COVID-19, I do know many, many people who are suffering from the economic outcomes of this pandemic. And so as we are dealing with 15,000 families at the Community Partnership for Families, there's probably an additional 15,000 families that are out there, people in service, people that are in the front lines working, that are going to be needing more of this type of service. So it's not going to go away. It's only going to get more so. And so I think that the trust that we have built within our community and committee are indispensable as we move forward, because it's going to take all of us. It's going to take the faith community, the public, the business community, the public works, mental health. It's going to take everybody working together and having trust. And so I'm hoping that as these ideas come down the pike and we get a little bit more meat on the skeletons that we can put together that will provide the services that we need, I hope that you'll be very aggressive in your willingness to support for your district. This is a county. It's a nationwide issue, but it is definitely a county, so there's not one city or one area that's untouched. We're all touched by it. So I just thank you all for listening, for having us here, and for taking this information to heart and making it work and making the outcomes better for everyone who lives in San Joaquin County, not only the homeless, but those who have homes, and hopefully those who will not ever become homeless, that we can save before they get to that juncture in their life. So thank you very much.
If I may just circle back real quick to Supervisor Elliott, I just got a text that we will be doing antibody tests out in the camps over the next 2 weeks. I'll report back probably within a month and let you know, and that's going to give us some direction as to what we've been dealing with. So I think I want to thank Joan Sinsing from San Joaquin County Clinics for just doing an amazing job. We'll start with the shelter staff first, like we did the testing, and then we'll roll into the clients and kind of get an idea how have we seen this. And I also wanted to mention Stockton Fire Department and Stockton Police and the Sheriff's Office have been huge partners in this, and they've just been amazing to work with.
Thank you. Supervisor Patty, you have a question?
Thank you, Madam Chair. First, I'd like to recognize Kristen Burtwhistle for your leadership in this little subcommittee, this hobby of a group of people that have come together for a passion of their commitment and community. I know that you've met with me and other supervisors over the past since you're taking over at United Way, and in those conversations you really took the ball and ran with it. And I also want to recognize, of course, Wayne Richardson at Gospel Rescue Center, our DA, Tori, your commitment, what you're doing. Mrs. Groupie, what you're doing, I can tell you that knowing your husband, he married up. You've done a wonderful job in the community, and he's basking in the glory of all the things you're doing. So it's a real tribute to your commitment to this community of yours and ours. Also want to recognize Supervisor Villapudua, your open dedication, and Christopher Pay, the dedication you have to this, and going the extra mile and working with Supervisor Villapudua, just making that commitment to this, your city that you're a big part of, your district, is incredible. When you first came here for funding several months ago, we talked about, to me, stage one or step one and leading to step two, and it seems like you've taken a real deep dive to have some fantastic analytics. And you come to find out that a lot of people have been at Stockton Homeless Shelter for 10, 20 years. But it seems as though we're bringing in some new people and getting some new analytics. And I really do agree that we need to really look at what's next. So it's not just a repetitive cycle, and in the winter we pop up something and we get some people in and they give a little bit of comfort and find out more things. I really believe that we as the supervisors and as a county and in partnership with cities and agencies, we need to look at what's that next step. And it sounds like to me we're understanding that we need support services, we need recovery. We need a myriad of elements that need to come to this county to have a deep impact. Doing math, we got 1,500 people, and if you just a simple number of $200,000 per person for housing, which we know is probably half of what it actually is, you're looking at we're looking at $300 million. And then you mentioned, Ms. Verber, that we've got 20% that are ready for housing. That's $60 million. That's at $200,000. We're actually looking to probably double that. So I think it's important that we really kind of, understand and have this board and this county and the cities, if we're actually going to have an impact, where are we going to be putting our money and our resources to help those most in need, those that have fallen through the cracks, those that have, children, those that have, a profound, personal health risk and safety and public health and public safety and the impact that it has in the community. I know that there's a program down in San Diego, and a big part of their funding is coming from HUD. And HUD has recognized, and they're bringing their funding there. And so I know through the CAO's office, we have Adam Cheshire. We've got a myriad of agencies and people and possible funding streams out there. And I would encourage our CAO's office and this board at some point, and I'm not sure what the next step is, if maybe we've got, Ms. Burwhistle, maybe you've got something that we're working on that can come to this board for consideration, but truly a commitment and a partnership to actually have an impact dollar for dollar and what we can do versus, because I know we're not going to get $300 million to help 1,500 people. Helping 100 people is going to fall way short. So if we start to look at where the tens of millions, and the hundreds of millions would go versus where the dozens of millions, $2 million, $5 million, $8 million, $12 million might have a deeper impact for 1,500 people versus looking for and waiting for that magic spaceship to arrive with $600 million available. So, I'm very pleased and happy to see that this was a great step forward and a first stage, and thank you for the report. I'm anxious to see what, this board could do to support the next phase going forward to have a deeper and more profound impact for those that are most at risk and most in need throughout our community.
Thank you.
Quite honestly, Supervisor Patty, I think your question is very well founded. The next step to me, as I'm looking at this in a broad picture, is some kind of a navigation center where larger number of people can come in and can be put into whatever category it is, whatever area it is that they have a need. So we can have children and families in one area, men in one area, men that have veterans that have different problems than other PTSD or other problems, people who have deep mental health problems, where we can actually coordinate the services and we can impact the people that we can have an immediate impact on. We can work with the people who need to be separated. We can work with the people who are deeply troubled. So we have to get to the point where we have some kind of a navigation or a triage center where we can begin to deal with the different groups of people. We can't deal, it's just too enormous. We cannot deal with everybody all at once at the same time.
And nor scattered about. So if you bring them to a central location, I know we've talked about in Adam Cheshire's, talked about that emergency shelter as being something that we're missing here in the county. So I guess the question would be, what do you need from any resources we offer at the county? And I know you've got an active table of participants. Is there anything that we could do to develop and come back with a strategic plan? We've got some COVID dollars through CARES that are dedicated. Yesterday came out with a new state requirement that we have to have the capacity for up to 15% of our homeless that need to be able to be secure in an environment if and when they're ever tested positive to that capacity. So what could we utilize with some of that CARES funding perhaps for this board to consider what might be best dollar for dollar? If we just spend $1 million for 70 people for 60 days, if you look at 350 or 400 people, we're looking at $10 to $15 million for 90 days if there's a second wave coming in the fall, which is possible or may or may not materialize. But what are we doing to be a step ahead and not flush all that money away without having a more thought out and a deeper program and a greater benefit to those that are most at risk and in need? So do you need anything from the county at this stage?
Well, To your point, one of the potential outcomes of the Winter Planning Task Force or Subcommittee is continue to plan. We need a capital strategy for expansion in place, I think, of our current shelters. Maybe we need an existing, whether it's a sprung structure or a dedicated building. We need a navigation center. We need to operationalize what I think what we have in this community is the right stuff, as they say. We've got a tremendous force in HSA within the county services. Greg Diegerick has done an amazing job as a leader in that area with the county clinics, mental health. We've got all the right, I think, pieces in play. We have a COC that's incredibly active. They're building on a home-based strategic plan, which has a lot of these elements. What they just haven't done is actually come together, put in on a written plan. Obviously, we're going to need support from the city and the county together. I'd like to see it certainly, and I know that I've heard this at our committee level, a much more active integration between the city and the county, whether it's funding or other sort of seeds of support. But we're more than willing to, and I'm saying this sort of out loud, and I maybe shouldn't, but we'd love to help create another plan to bring back to all of you with the right stuff players, frankly, at the table to see, again, what we can do. Generational poverty is a huge problem. And if we don't focus also on the preventive side of this, that's usually an element out. It's always the last thing to consider versus the first. And we're dealing actually with a lot of the symptoms, but not necessarily the solutions. So I'm hoping that this group, maybe we can go back with your ideas and suggestions and craft something that might be appealing to see how we can reduce homelessness even further. But more importantly, to look at housing as well. Great article in the New York Times this week that said the cure to homelessness is housing. And that is very true. But for the time being right now, we have to put as much effort into transition, mental health support, detox, and prevention as we do into housing.
Yeah, until somebody is balanced, when you have the people that have the issues that you have, we can all recognize that until they go into an entry point at that emergency shelter and have some wraparound services, they're not ready for housing. Absolutely. We already know that housing is destroyed, that housing, the cost basis. Orange County just spent millions of dollars rebuilding hotels for people that were temporarily sheltered in hotel rooms. So that's a big flush down the drain unless that person's stable and balanced. But these are all things to be discussed and considered dollar for dollar. And I would just finish and ask our CAO that perhaps we could visit with Mr. Ragsdale and talk about what they're doing down in San Diego and how they're using that HUD funding more for emergency shelter. And I don't know the ratio of dollars and what they're doing and how, but maybe we need to prioritize that emergency shelter approach as the entry, and then look at that next step in the stage forward. But we need to we need something more than status quo.
So is Mr. Ragsdale part of your committee? Okay, so I would highly recommend Supervisor Patty that come through the COC, because I know he's a member of the continuum of care, and so I would suggest that would be appropriate, because I know this board has recommended that avenue as being kind of where, we feed that kind of project.
Okay, thank you.
Also, Supervisor Patty, we're going to have a good pilot with the motel, because we are taking in, and it is primarily our senior population, people struggling with significant health issues and high risk for COVID. But we're going to have them for 90 to 120 days. And thanks to the great leadership of Chris Woods and Tony Rocha and Tony Valton, and I mean, they're there, and whole person care, and Greg Dietrich, they're there every day providing services. And I believe we have a day manager there as well. That's connecting to them and continuing to build them up. That's going to be great data for us to look at as to what they came in and how they came out of that service, and then how we need to provide those wraparound services to them. So that pilot, I think, is really going to be that gauging opportunity for us to learn where we're strong and where are the gaps in services, and how we can enhance those services to ensure a successful pathway going forward. So it'll be really interesting when we get to the end of this journey, which I think is in July or maybe August, what that looks like, and what kind of shape that these people are in, that were unsheltered, sheltered, with wraparound services and supported. And I think that'll answer your question, and I think it's a great question. It's the heart of the question. How do we do this? Because we want permanent housing, and it is a priority, but we know we're not going to have a significant amount of that until over years' time. Right now, how do we focus on these individuals by bringing them into the navigation or resource center, whatever we're going to call it? The top three things are going to be behavior health, substance abuse disorder, and animals. We have people right now that we've been trying to bring in, a gentleman that's in his 70s. He's in stage 4 cancer with the chemo pump on. And he won't leave that dog because that's all he has. And I know some people might mock that or think that's not right. But being out there and seeing the love and the compassion he has, this dog is more than just a dog. It is a comfort care dog. It is a service dog. It is the only connection he has from really losing it and going into a deeper state. So he won't come in. So when we build this resource center, there has to be the capability of bringing these animals in. And that's the number one. We've asked maybe 10 people over the last week to come into the motel. 8 out of 10 have said they won't leave their animals. So we have those. I know it sounds strange to think substance abuse, mental health, and animals are going to be the top three. And then that second tier of wraparound services is cleaning up your criminal history, if you have one, cleaning up your eviction history, if you have one, getting your credit back up, employable skills, job, resume, training. All of those, we have community-based organizations like Community Partnership and Mary Magdalene, all of these that do amazing work in that area. And I think Kristen hit it on the nail. I have never seen and worked with a better group of departments and department heads than I have in the county. They are so strong and hardworking and solution-driven that now is the right time. You're right. Now is the right time to do it. So we'll see. We'll have some data from our street work, and we'll have some data from the motel. And I think those will drive the finishing touches on this home-based project that COC is in charge of. And COC has done a great job navigating all of this.
The only last thing I would say is I think we have not months as we're looking for the analytics, not weeks, but I'd like to see in days we're moving forward with something for us to consider while we have possibility of different funding sources.
And that other county that put people into a motel, they're not as good as San Joaquin County. We'll do it better than them, I guarantee.
I'm certain of it. Thank you.
And I just want to close by saying really a common success factor that we've seen across the country is when the city and the county are working closely together. Monica, you've done an amazing job with the county, and I want to thank you for your support. We were talking at one point, wouldn't it be great if we had a division of homelessness where there's herds of people that were there to really, well, I won't say herds of people, but it's good, very, very strong people working together. And, even if we go back into the history of the Stockton community and the county, we had a great model, actually, in the Stockton State Hospitals. I read, the annual report from 1958 from the Stockton State Hospital. And everything we described here today, from treatment, to detox, to preventive services, to staff support and training, to work hardening, was all a part of Stockton State Hospital infrastructure in 1958. So I think if we go back and actually look at the strength of what has actually happened, unfortunately they closed those down in the early 70s, that was the start. That was the pivot point, the flash moment when homelessness started to gain ground. And so I'm excited that maybe we can actually look at a model with a great group that we have here, members of the COC, members of, again, the Board of Supervisors and the City Council, and all the other great multiples, I never say that word right, agencies that really support, again, the people of San Joaquin County. So thank you very much for your time today. We really appreciate your direction, your guidance. Thank you so much.
Thank you. Before we move on, I would really like to thank all of you and everyone that's been involved in this effort. You know, for a lot of us, this wasn't something we sought out. It was something that came to us. It was a crisis. It was an issue that just appeared to us, and we answered the call and we stepped up. When we formed the very first task force back in 2015, the goal was always to expand our capacity beyond specific agencies, but to foster partnerships between the county and also all of our cities and other outside agencies, including HUD and state agencies. And the goal was always to institutionalize the structure so that as time went on, some of us would step back to allow others to step up and bring their new ideas and their leadership qualities and their outside of the box thinking and apply it to this issue. And I'm so pleased to see that that's exactly what has happened. Some of you have been involved since the very beginning. Others of you have become involved over the years. And when Supervisor Wynn and I were first assigned to the task force, we purposefully, when we formalized the continuum of care as our backbone planning agency, we purposely stepped back to allow other supervisors, because we're bound by the Brown Act. Only two of us can be assigned and serve on these things at one time. And so it was a very conscious and purposeful step back on our part so that other supervisors could bring their passion, their enthusiasm, and their good ideas to bear on this issue. And I think we're all very gratified to see the results here today. We look forward to seeing more. I'm very encouraged with both the home base strategy coming forward, the continuum of care continuing to develop new funding streams, and the new individuals that you've got engaged in your committee coming together and continuing this work to bring these recommendations forward to the board. So we're going to look forward to seeing more good ideas coming. And you know, what's the old adage? You never want to waste a crisis. There are always new funding streams, new perspectives that come to the forefront in a crisis that we need to figure out how to take advantage of them, and for the benefit of all the residents in San Joaquin County. So thank you all very, very much for this presentation today, and we're going to look forward to. Before we go, Supervisor Villaputu, you haven't.
Yeah, just a quick comment. Thank you, Chair. So first of all, I just want to thank you for this report, and I just want to tell each and every one of you that I hear from firsthand from Chris what an amazing job you guys are. You guys are working from your heart, and that's amazing. Chris talks about you a lot, and you do a great job. Phyllis, you know, you're a superstar, and Tori, we're so blessed to have a DA that's out every night working so hard, and you're not getting overtime, so I feel bad about you about that. But you're doing a great job. Chris, it's nice to see you. I haven't seen you in a long time. But anyways, no, Chris is doing a great job. I'm so happy that he's can help you guys. And, let's continue to keep up the good work, and I'll volunteer to cook for the homeless whenever you guys want. So thank you so much.
Okay, hold them to that.
Okay. Thank you all.
Thank you.
Okay, we're going to move on now to public comment. Public comments we ask that you limit them to 250 words or less. They can be submitted by sending an email to the clerk of the board at cobrecords@sjgov.org. Comments received prior to the meeting or during the meeting, we will make every effort to read them in their entirety into the record. Some that are very long, we will edit them for for time, but the entirety of the comments will be entered into the official record of the meeting. So I'm going to ask the clerk to read any public comments we've received.
Thank you, Madam Chair. Our first comment is from Denise Jefferson, who writes regarding relaxing regulations towards fighting the COVID-19 virus. Please note that I join the majority of Americans in supporting continued efforts to contain the COVID-19 virus by stay-at-home orders, social distancing, and the wearing of face masks while in public. We are not out of the woods yet, and to relax the restrictions places profits above people. Relaxing the regulations now will certainly result in more positive cases and deaths. I don't feel any of our community members are expendable. Do you? Kenneth writes, please help small businesses at this difficult time. I own a small salon in Stockton and have for 35 years. There are only 5 of us, all independent contractors. We have been closed since March with no income from clients. We are beyond having a tough time struggling to pay bills. They, of course, cannot pay me rent, so I can't pay my landlord. There is nothing in place in the way help for me being a sole proprietor with no employees. My small salon can easily comply with social distance guidelines, 1 client at a time. Please let me open. If this continues, bankruptcy will be my only option. Thank you. Jason Kimmel Jr. of Vineyard Floors writes, even as an essential business, we have been affected by the stay-at-home requests. Let's note that these are requests and not laws. I'm a factual person, and it appears that California has been pulling back despite the positive news. As business owners, we have the ability to open safely, and consumers has the ability to further protect themselves. Looking back, and it appears that the stay-at-home orders didn't improve the situation. By limiting stores, we forced consumers to have large gathering at select locations. The focus should have been to protect those over the age of 70 years old with pre-existing conditions. Ideally, if the healthy had been exposed to the virus already, then we would have built up antibodies and would have been the wall protecting the elderly going forward. The most important aspect is to realize that this is America, and we should have the freedom to choose what is best for ourselves and those around us. The federal government is leaving the decision to the states, and the states are leaving the decision to the counties. I strongly believe that the counties should leave the decision to the people. Give guidelines and offer support, but do not regulate. Leah Schulter writes, hello, and referring to the May 12th meeting, she states, as yesterday's meeting has shown, the primary objective for many of you seems to be obtaining as many emergency funds as you can due to the COVID pandemic. I would like for you to each share what you will be utilizing the funds for and how much you plan to spend on which issues. This can be shared via email reply to me or publicly. It should be transparent and have follow-through. Your constituents will be watching to ensure it is used how you say it will be as well. Kelly Garcia writes, to whom it may concern, please listen to the people of Lodi and open up San Joaquin County. Our kids need their playgrounds. Our families need our rights back. This has gone on far too long. Please let us open back up. This is not right. Our kids and the people are suffering. Please, we want to get back to work. Betty Wilson writes, Dear Supervisors, the Business Council of San Joaquin is proud to support the important work of the Public Health Department and its employees during these unprecedented times. It is critical for the long-term health of our community that people are able to go back to work. We support the efforts by our cities and counties to increase testing sites. We also encourage our Public Health Department to expand contact tracing protocols. We believe that there are safe ways to open the vast majority of our businesses, and we support flexibility for our county public health officer to adjust local procedures to best protect our citizens and enable our businesses to open. The Business Council is committed to partnering with our local government leaders to maintain the health of our community and promote a positive environment for our business. James Oliveri writes, we need our lives back for our children's sake, please. We all have a choice. If you're scared, stay home. Life goes on. Tracy Gals of the San Joaquin Delta Neighborhood Watch writes, it is time for you to move forward with the help of California Water Board to relocate the homeless vagrants off the waterways. What our city and county elected officials are allowing the tax-paying, law-abiding voting residents around the waterway to be subjected to is unconscionable. They are being victimized daily by the homeless, vagrant encampments, poor choices, behavior, and crimes. You have collected enough data to fill a library and spent enough money to build a whole community. So it is now time to stop talking about it and start implementing true solutions. As a large part of the problem is drugs and mental illness, and this first needs to be addressed. Please let law enforcement enforce the laws, make the nonprofits and all San Joaquin County and city homeless outreach agencies be accountable for their performance. Let the DA prosecute criminals that break the laws that were intended for all citizens of the United States, and the judges to sentence the criminals to appropriate time for the crime. There are two sides to every coin. Let us try looking at the second side of that coin. That is, arresting, prosecuting, and incarcerating the criminal. You will be helping not only protecting the community, but protecting the criminals' safety, health, and welfare by giving them an opportunity to make life choices with a clear and clean mind. San Joaquin Delta Neighborhood Watch continues to fight the uphill battles that our San Joaquin County and city elected officials have yet to resolve. Frank T. Reuzzi, homeowner on the Calaveras River, writes, my neighbor and I went by boat up the Calaveras River between I-5 and Pershing last week to help tie ropes to appliances and furniture in the water for removal by channel maintenance. The grocery bags and buckets full of feces and the vagrants living in the river are taking over the waterways. There are also hypodermic needles floating in the water and on the levees. The health of our river needs intensive care before it's too late. The bottom-feeding fish have already disappeared, and the birds and mammals are dying off too. 20 years ago, Pete Audiston, outdoor writer for the Stockton Record, did an article about kayaking that same stretch of the Calaveras River and all the wonderful wildlife he saw. I would love for him to take that same trip today and write another article. We need to remove the illegal campers from our waterways. We have laws, so why aren't we enforcing them? It's time. Lourdes Sobredo, retired California State Administrator, writes, these are serious times requiring serious health policies, enforcement, oversight, and action to ensure adherence to orders issued by the state of California to reduce the spread of coronavirus. We, its citizens, need our county leadership to act responsibly and require others to do the same. The rare times that my family members go to the grocery store or curbside restaurant pickup for food and other essential supplies, we each wear a mask, sometimes an eye covering because I am high risk with an autoimmune chronic illness. But too often than not, there are people at these places of all ages and ethnicities who do not wear a mask or who may wear them but incorrectly, not covering their noses. So please, I call on you, the county leaders, to do your job sensibly and with an eye towards preventing, reducing COVID-19 cases and deaths, and to make testing more accessible. Reopening economy prematurely exposes the community to too much risks. Please seek health experts if none exist among your county leadership. Another FB friend, Marika Wolf, also suggested to add these words from Dr. Fauci. Quote, if we skip over the checkpoints in the guidelines to open America again, then we risk the danger of multiple outbreaks throughout the country. This will not only result in needless suffering and death, but would actually set us back on our quest to return to normal. End quotes. Thank you for your time and effort to reconsider not reopening businesses not considered essential to ensure the general health of our population. Wendy Maxwell of Stockton writes, please do not let a vocal minority of people create health problems for the rest of us by reopening the county too soon and without sufficient guidance. If we do not get COVID-19 under control in San Joaquin County, we will continue to experience this cycle of illness and death far too long. Please take the lead in supporting specific, sensible, data-driven guidelines informed by local and state public health opinion. Even with stay-in-place orders, I see people at the grocery store without masks, groups of people walking closely together. I hear people on Facebook and in the news who believe that COVID-19 is no worse than the flu. These people frighten me. One of our out-of-state cousins is ill with COVID-19. We don't really expect her to pull through. I too am at risk, age, medical condition, and do not want them forcing my world to become more dangerous just because they are bored, frightened, or misunderstand what we're facing. At a minimum, can we please have county guidelines requiring masks in public? Not masks if you want to wear them, but masks whenever you are in public. Stop letting the grocery store workers in the deli give me food without wearing a mask. Stop pharmacy staff from handling me my prescriptions without wearing a mask. This is a crisis where we need you to be strong, sensible leaders, able to stand up to special interests and protect everyone in San Joaquin County. Crystal Holtz writes, "Hello, Board of Supervisors. We need your help getting homeless and vagrants relocated from the waterways and residential communities. I live on Smith Canal, and we continue to struggle with water quality and safety due to this issue. Vagrants come and throw trash in water despite the fact that a dumpster has been put there and defecate directly into the water. We continue to see open needles floating in the water, which is a huge biohazard to our children and community. Please help us by enforcing the fact that they cannot be on the waterways and relocating them. Keeping Stockton a nice place to live is critical to attract families and drive our community." Darlene Porter writes, "A native Californian, I am 76 years old and I'm not afraid of the COVID-19. I am doing everything to take care of myself. Please do not make young people suffer because of few of us that are older. If you let the shutdown go any further, you will not be able to bring this country back. I understand the medical doctor keeping things closed up. He does not want to blamed for more people getting the virus. We have to get it so it will go away. We don't have a vaccine. I also own rentals, and the new law, no evictions with an open timeline, is very difficult. Can this law be repealed or modified at least 90 days after COVID-19 declared over? When will it be over 2 years from now? What you are doing to this country is a big mistake. People and small businesses are really suffering because of the shutdown." Amy Maldonado writes, "To whom it may concern, I am writing in regards to the closures of schools during this pandemic. My daughter is 14 years old and a competitive year-round swimmer. She is used to swimming 2 hours a day, 6 days a week at the Tokay High pool. She needs this exercise. I would like to encourage county officials to please open the school facilities and let the kids go back to swim practice. It is not healthy for my daughter to be sitting in her room all day doing homework on a computer. She needs to have some sense of normalcy, and swim practice will definitely help. I'm confident that her coaches would be able to enforce specific rules and guidelines in regards to COVID-19, and the swimmers will comply, as they are so eager to get back in the water. Thank you for taking the time to read my email, and thanks for all that you do." Ari Hope writes, "Members of the board, on Sunday I saw a trailer had been pulled next to the river next to Stag High. On Monday they had turned it 90 degrees and had a truck and a car parked next to it. I hope you can get them removed soon, as I am sure it is illegal for them to be there. The longer you wait, the more expensive it will be to get them out of there." And then Mrs. Hope wrote in this morning that it looks like someone did their job. Thanks, the trailer and cars were gone this morning. Bill Wells, Executive Director, writes, "The California Delta Chamber and Visitors Bureau hopes that the San Joaquin County Board of Supervisors will take strong action and remove the vagrants living on and adjacent to local waterways and residential neighborhoods. This is a disaster that has continued to grow because of inaction. Boating is a $750 million business in the California Delta. This is a lot of money that is generated for local businesses and tax revenue. These people pollute the waterways in every way imaginable and also pollute and destroy local infrastructure. We urge the Board of Supervisors to relocate these people to other locations where they can be monitored and prevented from bringing harm to the citizens of San Joaquin County. The status quo is unacceptable. We need to take action." Craig Truxclair of Lodi writes, "Good morning. As you may know, many of the charitable organizations here in the county depend on much of their funding in thrift stores run by their groups. As a frequent visitor to these thrift stores here in Lodi, I can attest to the fact that before the lockdown, it was common for me to be the only customer in the smaller stores, and rarely could it be called busy in the larger ones. Add to the fact that thrift stores' most commonly sold item, clothing, has been scientifically shown to be one of the least hospitable environments for the coronavirus, makes allowing the reopening an easy decision, in my opinion. I ask that you let your empathy for domestic violence victims and their children, your concern for the homeless, and your love of animals lead you to decide to let these establishments open as soon as possible." Diane Gandolfo Marino writes, I am not protesting social distancing. I am protesting government overreach and an unnecessary burden on our economy. I am protesting the silence of civilian voices in our democratic process. I am protesting the unnecessary closure that is crippling small seasonal businesses in our county and state. Don't get it twisted. I am protesting tyranny, not caution. Caution is advisable. At gas stations, at grocery stores, anywhere we go in public, those who want to protect themselves are wearing gloves, masks, sanitizing, and disinfecting. But nobody, not even the government, has the right to tell someone else what they have to wear, where they can and can't go, what they can and can't buy, etc. Fear is never an acceptable excuse for violating the rights of Americans as a whole. It's a cop-out. Does closing some businesses magically make people stay 6 feet apart at the stores that are still open? Nope. Does someone not wearing a mask or gloves magically nullify your masks or gloves? That's totally not how PPE works, so no. Does someone in their car risk contaminating you in your car? Also no. Subjugating our fellow citizens does not actually make anyone safer. It just makes people feel safer. Oscar M. Cano of Stockton writes, please vote to open all businesses immediately. Leah Suelter writes, Dear Board, with Newsom announcing new threshold requirements for counties today, please call for a vote and decide on the record if we can reopen. We are under threshold requirements. It has been 9 weeks. If you choose not to reopen, please share publicly what your emergency funds will be used for both in the past 9 weeks and the future. Nicholas Hatton writes, Monica Nino presented to you her version of my last-minute science project, and instead of you giving her a virtual beatdown for her embarrassing and laughable homework, instead you unanimously voted in support of it. Each of you should feel ashamed. Following this meeting, do yourself a favor and Google COVID-19 CARES Act county proposal, and you will see a long list of reports that serve as evidence that other county administrators worked with their cities and communities and came up with smart plans that are worthy of their huge salaries, not Monica. What Monica Nino submitted to you was just an accounting scheme. You now owe the people of San Joaquin County an apology. There is a way to structure a CARES Act package that will actually help San Joaquin County reopen and act as stimulus funds for our area. First, serve Nino with her termination papers. Second, vote to remove the accounting scheme she proposed and you voted for. Third, work with our local mayors and businesses and come up with contracts that will fund meals, that supports rent relief, and that awards local contracts for producing local PPE for our county employees and frontline businesses. This is the fiscally conservative thing to do. I'm sure that's something the majority board can comprehend. It's also the Christian thing to do. You know that whole caring for one another thing? So throw away Monica's last-minute completed homework and start all over again. It's the least you can do. Jackie Minyard of Tracy, California writes, I am in support of opening all businesses. I want all businesses to be deemed essential. I urge you all to vote yes to open all businesses immediately. The current unfair act of just allowing big box stores to be open, but not small mom and pop shops, makes no sense. It is also very hurtful to many to be called non-essential when we have worked very hard making a living at our job for years. Help local revenues by getting local tax dollars by opening all businesses. Thank you for your support of your local community. Douglas Zuwalki writes, Good afternoon, board members. It has been very apparent that the county is ready to reopen. I continue to see people speak with their wallets and their feet, even if their mouths remain silent. It is time to use any and all leeway that our governor has opened up to get our county drastically moving back to where it was prior to COVID-19 shutdowns. I know members of our county are traveling to other parts of the state to express their desire to return to normal, and we need to keep our population here and not continue to incentivize them to travel to other cities and counties around the state. Here in San Joaquin County, we are well within established parameters to reopen. Please work diligently to bring an open San Joaquin County back to reality. Margaret Rowan, owner of West Valley Rubber Stamp, writes, I am a recipient of both the PPP and Main Street launch grants, thanks to the federal government and the city of Stockton. My business has been open during this time, but has not worked much because of the restrictions on businesses who need my services. While the grants have been a great help for these last 2 months, my business must see a flow of work before it can again stand on its own. In order to fulfill my obligation to maintain a work status for myself and my business, we must have the complete and unrestricted ability to return to work across the state of California, San Joaquin County, and the city of Stockton. Let us become the first city to fully reopen responsibly, including hair salons, bars, gyms, and particularly the Stockton Arena and Banner Island Ballpark. Let's get our vendors back to work. Let's get our employees back to work and make some money to build our economy. I am fully confident that the people of this state, county, and city are capable of using the knowledge and common sense to reopen their businesses in a smart and effective way in order to keep themselves and their clients safe, healthy, and prosperous. Thank you for allowing me to voice my opinion. From Kim Miller, I am asking you to declare all businesses as essential. Please open all of our businesses here in San Joaquin County. We are ready and prepared to follow all guidelines. Let us open. Please let us open. I don't want to lose everything that I have been working so hard to achieve over the past 20 years. Thank you for working with the governor's office to open up San Joaquin County. Thomas Hejza writes, I am writing again in support of opening up our county. It's my understanding that we are below the benchmark set for opening. My wife is a business owner, and this is affecting our family. The choice should be the individual's if you want to go places or not, wear a mask or not. As a populace, we SIP like you asked, and now we are asking you, do us a recommendation and let people get back to work. How some are essential while others are deemed not make sense. Isn't feeding a family and maintaining a home essential for every American? Isn't making money and paying taxes in the county essential? I understand most of our county's cases are closer to the Bay Area, where people commute in and out of. What not open up the parts that aren't so bad and do a step approach? Doesn't seem right to punish the many for the actions of the few. Thank you for your time. Teresa Reza Delp of R. Delp Photography writes, good morning. I appreciate the time you take to read each one of the emails you have coming in from our community. I would appreciate it if you guys to look at the new data from Governor Newsom announced on May 18th. I believe that these new guidelines, our county should have met them by now, and there should not be any cause to keep us locked down any longer. According to a Google search, we have approximately 760,000 people living in San Joaquin County, which means we must have 190 cases or lower to meet the requirement. As of 5 p.m. on May 18th, we have 126 cases, well under the 190. I would like to ask for transparency. When will things open, such as parks for the kids to be able to play on the playgrounds? I know some towns have opened theirs in San Joaquin County, however, Lodi Parks have not, and we were told that San Joaquin County has to make that decision. Currently, our parks in Lodi have been overrun with the homeless, making messes and destroying things. Our children deserve the chance to play and have a childhood outdoors, not locked up like caged animals. It is time to open. I ask for you guys to vote and vote today to open. We all have done our parts. Time for you guys to do yours. Thank you. Roger Kelly, lifelong resident of Stockton, looking for change. I miss my old neighborhood, the one that wasn't littered with trash, hypodermic needles, and bags and bottles of buckets of urine and feces on the land and in the Calaveras River. I've done the work of volunteering for the California Water Board, sampling the water throughout the Stockton Delta, proving the problem is real with the homeless vagrant encampments, with test results for the maximum E. coli reading recordable in multiple locations. The COVID crisis should open your eyes that these encampments are a clear danger from a health and safety issue. The California Water Board has a directive to relocate the encampments off the waterways. It needs to happen. We spend an enormous amount of money cleaning up these camps. Caltrans won't react until there's a fire. The large fire under I-5 in the Calaveras caused significant damage to the north bank, causing Caltrans to epoxy coat the damaged concrete. This fire was not published, but the one under Smith's Canal and I-5 and Pershing overpasses also had fire damage. I filled out a CSR last September and still no action on the south bank. Wait until the encampment starts a significant fire. How much would it cost to close I-5, not just Caltrans, San Joaquin County? I make recommendations the board supervisors make an ordinance to seize vehicles that are responsible illegal dumping. San Joaquin County needs to invest in cameras to prosecute illegal dumping. Barbara Berrigan-Perea writes, Dear Supervisors, the COVID-19 CARES Act money should be used to secure PPE for San Joaquin County essential workers, contact tracing, and to step up education and enforcement with area businesses. It should not be used for supervisorial accounts where the funding can too easily be used as part of a political patronage system. The point of the CARES Act was not to build reserves, but to invest in the community during the pandemic. Cities with the population numbers that led to the condition for obtaining the funding should be funded for the services that they are providing. Additionally, the county is failing to hold businesses accountable, citing that too much staffing would be required for enforcement. In our stores, too many employees do not wear masks, have gloves, or wear their masks correctly. Public health representatives, if properly funded, could be making site visits not to penalize businesses, but to coach them into doing the right thing and to deliver PPE products to set businesses on the right path. The virus isn't going away because parts of California are going to be reopened. Instead, the county is allowing itself to be held hostage by COVID deniers who think masks are for the weak. It's time for San Joaquin County to join the 21st century and to stop clinging to backwards policies. Redo the COVID-19 CARES Act plan immediately. Spend the money correctly. Start serving all the people of the county equitably. Renee Elliott writes, you are creating a slush fund instead of funding the needs of the county with the CARES Act funds and are using it for a $3 million expense account for each county supervisor to spend as they want, like paying off their special interest political friends outside of their districts. B, a $100 million account reserve to pay the county's bills and earn interest when these dollars are supposed to help people and businesses. And C, and the federal or state government can demand the return of CARES Act funds for San Joaquin County if they are misused or if they put a spend by demand on the funds. Monica Nino needs to stop with the accounting schemes and start doing her job. To our Board of Supervisors, your support of a plan that does not support the people of San Joaquin County during a health and financial crisis is unacceptable. I pledge to stand against your abuse of power. Debbie writes, does any one of you ever go out and look at our problems? Do any one of you own a boat or have a friend with a boat? How about anyone live on waterfront property? How can you look away from the damage of our waterways? I cannot believe you don't care. Go look how nasty our city and county is, and you people don't care. Please, please do something. It's been going on for a long time and not getting any better. We need leadership to do something. We are willing to help. Who is the leader? That's what you signed up for, isn't it? It's time to make this city and county better, not worse. You talk the talk, now let's see you walk the walk now. Michael Bezanet from Tracy writes, to the San Joaquin County Board of Supervisors. At last week's special meeting, the board voted to allocate only 12% or $15 million of the Federal CARES Act, $132 million funding to the cities of San Joaquin, keeping the remaining $117 million county use and placing the lion's share of funding in a rainy day account for future pandemic expenditures. The allocation of $3 million to each of the 5 cities in San Joaquin County is a slap in the face to the county cities which are bearing the significant financial costs required to mitigate and manage the spread of the deadly COVID-19 pandemic in their communities. We look to you, our elected leaders, to protect the people and businesses in the county cities from harm. A $3 million allowance is grossly insufficient to fund the imminent cost to battle the pandemic over the coming months. I have no doubts that each and every San Joaquin County supervisor is fully committed to the health and welfare of the people they serve. Their decision last week to limit CARES Act funding for cities is a huge mistake that may cost lives and the financial health of the cities. I beg that the board reevaluate last week's decision and vote adequate pandemic funding for the cities. Lindsay Bentley writes, "Good evening. I'm a full-time working parent of a current first grader of a Lodi USD student. Please keep us working parents in mind when discussing opening up for the new school year. It is difficult and overwhelming to handle distance learning on top of working for an essential business during this time. I rely heavily on school time for her education and feel that distance learning does not serve the community's best." Monica Fritz writes, "Dear San Joaquin County Board of Supervisors, I once again urge you to take a stand and open up our county fully. The curve has flattened. Our hospitals are prepared and laying off staff. Our children have been prisoners in our homes, unable to attend school. Parks, extracurricular activities, or even go to the library to check out a book to read. Our once thriving small businesses are now in massive debt, while our large big box stores and Amazon have a monopoly over them. What has happened is a violation of our rights to life, liberty, and pursuit of happiness. Do not allow this to continue any longer and free us from the unconstitutional overreach by our governor. Ronald Reagan once said, quote, 'Freedom is never more than one generation away from extinction. We didn't pass it to our children in the bloodstream. It must be fought for, protected, and handed on for them to do the same. Or one day we will spend our sunset years telling our children and our children's children what it was once like in the United States where men were free.' End quote. Please open up and give us our freedom back for the sake of our children." Marcia McRae of Tracy writes, "To San Joaquin County Board of Supervisors, I recently learned of your decisions last week regarding the allocation of funding from the Federal CARES Act. I am concerned that the portion of monies allocated to the cities within San Joaquin County is insufficient to supply the help needed to our communities during this unprecedented pandemic event. Putting the majority of money away for future use may prove detrimental to our cities who need help now. I am on a community Facebook page that receives comments daily about the devastating financial impact to our neighbors who work for businesses or own businesses in our city of Tracy. I know our supervisors live in our cities and must be witnessing firsthand the impact upon their own neighborhoods and businesses. I am confident that each one of you would prefer to see our cities return to normal as soon as possible. I hope you will reconsider increasing the amount of monies you will allocate to each city. I am sure that each of you would be willing to acknowledge that, quote, 'an ounce of prevention is worth a pound of cure,' end quote. I urge you to consider taking the necessary funding steps now to prevent an even greater impact upon our financial security in the future." Carrie Curry and Marianne Cox Martin writes, "Dear San Joaquin County Board of Supervisors, on behalf of the San Joaquin County Democratic Central Committee's Issues Committee, we would like to take this opportunity to provide insight and input on behalf of our community's $133 million allotment of CARES funding. In order for our county to thrive to its fullest capacity, we must work together. We must make our efforts of creating safety and economic stability for our entire community one that will reach far and wide. There are so many nonprofits and individuals that are doing the work, but help is desperately needed. Please consider some of our solutions and recommendations on behalf of our community as follows. As a concerned community members, we ask the Board of Supervisors to consider funding expansion of homelessness relief, the many job-generating small businesses, expansion of mental health services, and community-based services. We share concern for our parks and recreation, local farmers, and migrant workers who need access to healthcare clinics. Please consider aiding childcare access and our county college students. This pandemic has exposed increased need for public mental health services and the importance of supplying appropriate PPE to our essential workers who care for us each day. And in order to open our community safely, it is critical we provide more testing sites. We ask the board to ensure that these funds help protect our surrounding cities by reimbursing the cost of COVID-related services each city has incurred. Henry Rodriguez III writes, I am writing in response to agenda item number 1 about the Public Health Services Replacement Project costing $25.4 million. It appears that the PHS lab costing $6 million is 1/4 of the cost of the entire project, and I am wondering if the legal requirement requires the county to do their own lab work, or would it be more cost-effective to contract it out? Does the lab director or public health director have data to show how the costs of doing lab work in-house compares to contracting the work out, and if it would be a savings to the San Joaquin County? I wonder if the lab, which costs over half of what the other building totals, needs to be in-house. Conversely, if it does, why not make it a part of the main building instead of a separate facility? One final question with regards to COVID-19 update and the apparent endeavor of the board to open San Joaquin County. Does the Board of Supervisors feel confident enough to open up the county despite not meeting metrics for homeless housing? And with the growth of new cases in the past 5 days, what is the legal ramifications of opening up and not meeting the metrics that have since been lowered by the governor's office since yesterday? Does this mean our county might not get emergency funding should an outbreak erupt if we move forward? If so, is the board prepared to pay for the loss out of the budget? As Dr. Park usually points out, the cases line shown on the dashboard will always go up since it is cumulative, but the concern is in the last 7 days there have been 86 new cases. I just want to make sure asking to open up is the decision the board is ready to make, as they will all have to risk their positions and careers when they decide to move forward with this. They do great work, and with any new building, they are going to continue their efforts for many years to come. Gina Castellano writes, "Good morning. I would like to ask that the board create an oversight committee over the $3 million that each district now has to ensure transparency and accountability. Each district has its own challenges." Jeremy Terhune writes, "Dear Supervisors, I am deeply discouraged by the approach the county administrator has crafted to place $100 million in reserves while granting supervisors $3 slush funds in grant in some sort of political patronage system that does not appear to follow the spirit of the COVID-19 CARES Act. We need stronger leadership from you. I have personally witnessed that many of our essential services stores are not enforcing social distancing or mask wearing as being done in other parts of California. San Joaquin County is reaching 700 cases. Please help keep vulnerable community members safe." Gail Homestylist writes, "Good morning. The governor has changed the guidelines and now the county has met the most difficult metric being new cases and low death rate. We know the supervisors are not in charge of meeting the criteria of the governor. However, Health Office Maggie Park is responsible. Citizens want to know, as of 5/18, why the following metrics have not passed. Straight answers. Containment capacity. Why are there only 50 contact tracers when 114 are required? Why are there no homeless in the Motel 6s? You can't find and transport 395 homeless people? Nursing homes don't have a 14-day supply of PPE and ability to receive supplies. Why not? San Joaquin County is not on the list to move to the next phase. Citizens want to know this delay is unacceptable. I request the supervisors ask these specific questions to Ms. Park, as I will not get a public response to my email, and Ms. Park needs to answer this publicly. Our businesses needs to open now. These delays are crippling us. We hope to hear answers today. We are listening." Amy Portello Nelson, resident of Stockton, writes, "I am extremely disappointed in the lack of transparency the county administrator showed last week with her plan for allocating of the CARES funding for San Joaquin County. The proposal should have been to accept funds and create a plan for allocating that included city, resident, health, and county leadership. Instead, Ms. Nino proposed to reimburse current county health costs, then hold the maturing of funds until late July before deciding if any more of it could be spent. It is understandable for the county to hold reserves for fall, but this is excessive. It is irresponsible to allow cities within this county to continue going further into deficit for months by assuming they will be getting FEMA money. And maybe there could be ways for cities to help with the selection and distribution of businesses and nonprofit support within their boundaries, instead of giving each of the supervisors $3 million to become an ad hoc philanthropic foundation. At last week's meeting, even the supervisors themselves seemed nervous about the endeavor because it is not a system that can be performed with objectivity, transparency, or expediency. Please revisit the allocation approved this week and develop a plan with partners throughout this county. And today's agenda packet shows that San Joaquin County is also set to receive another $2.5 million of COVID-19 relief from HUD. We expect that funding plan to be presented in detail to the public before it is allocated for spending. Dr. Douglas M. Martin writes, "My name is Dr. Douglas M. Martin. I have a business in Stockton. I am 80 years old, intend to work 14 more years, and I want to catch this virus. I want everyone in my family of 6 children, their spouses, and many grandchildren to catch this virus and put it behind us. Become immune as we have all the other diseases we have conquered in the past. Sweden treated this illness as we have every other illness in the past, and their experience is that this puny virus is no worse than the seasonal flu. In fact, it is far less dangerous to children. Looking back, we made a very, very bad mistake closing any businesses or altering our behavior in any way. Sweden followed the correct path. Do nothing, let the disease run its course, and go on living as we have always done with diseases. Governments has destroyed our economy, and further government interference in stopping or slowing businesses is unjustified. Atwater acted correctly. Follow Atwater's lead. Declare San Joaquin County a sanctuary county. We citizens can choose our future. I demand a return to constitutional government where citizens' rights are not trampled upon by politicians outside of the law. Get this government out of our lives and businesses. Any future infringement upon our rights as citizens should be looked upon as treason. The oath of office for most government services is to defend and protect the Constitution. Keep your oath of office. Going forward, please do not commit treason." Nate Worth writes, "I was shocked to hear our county administrator say that none of this CARES Act funding would be passed through our cities. She stated that since these cities don't have the population size to qualify for these funds, then they will not be receiving any. The county qualified for these funds because of the populations who hang their hats in these cities. The cities that serves this county citizens could potentially be ideal pass-throughs for funds as they have a more detailed perspective of their citizens' needs. I would get her point if we were paving roads here, but these funds are quite far outside of the standard city versus county mentality. While FEMA funds will be available for cities, our cities receiving these funds is not guaranteed as of now. Why is there not more transparency on the $2.6 million in CARES funding being given to our county by HUD? I'd like to hear what the plan is for these funds. As a side note, having to dig through 147 pages of agenda items to find information on those funds is an unrealistic expectation in regards to transparency. Can we talk about better ways to share information on the decisions you are making? I can appreciate rainy day funds, but to freeze 80% of these funds for 60 days during what for many is an emergency seems counterintuitive to the purpose of those funds. I also appreciate not wanting to spend these funds until you have a plan, but sitting on that plan for 2 months may lead to you throwing water on a village that's already burnt down." Barbara Hammond writes, "I am an independent contractor at Pomp Salon here in Stockton, California. I am in support of all businesses opening as essential and would appreciate the board and city's vote that all businesses open immediately. We have done so well keeping the numbers low in a city population as large as ours and, bigger picture, a county population of over 760,000. It is time to reopen before more businesses are forced to go under. There are so many small business owners and independent contractors like myself who are willing to take the steps necessary to ensure safety of our consumers as we resume businesses. Every small business owner had the American dream, and this extended lockdown is snatching that away unconstitutionally. We are aware and believe that safety is of utmost importance, and will be sure to take care of our guests as if they are family, because we will not survive without them." Dominic Guelli, small business owner, district engineer for numerous Delta reclamation districts, writes, Thank you all opening the golf courses, second, the boat ramps, and third, the dumps, the 3 places I visit most on the weekends. I had never been to the Waverly Road real dump and must say it was the most well-run landfill I have ever seen, and believe me, I have seen more dumps than most anyone. Part of my job in this county is to support bars and restaurants. My wife, Shelley Gregarison's budget for such purposes exceeds $2,000 per month, and I request that the Board of Supervisors do everything they can to not only open as quickly as possible, but to also resist the overly stringent government control that the California Democrats will surely impose on how a small business can operate or how I can interact. I hope and pray that I can go to Papa Pavlo's, sit directly next to someone at the bar without a mask. As most Americans likely agree, we can take care of ourselves, and we will take our chances on getting the flu. If we are high risk, we can find a restaurant that practices strict social distancing or get takeout. On behalf of the following parties, please act strong and tough and make San Joaquin County great again. Elkhorn, Papa's Market, the Vegas Garlic's Windmill, Bob's, Midge's, Dante's, the Anchor, Senior Frogs, Octavio's, Bud's, Gustus's, the Waterloo, and all the other establishments that expand my wife's budget. Thank you for your listening and acting on the public's concerns. Tim Moody writes, I represent the landlord and tenants of the former Tracy Outlet Center that has turned into a primary local community center with local youth-centered service tenants such as baseball, dance, wrestling, martial arts, athletic, training, gym, and 2 churches, among other traditional stores, such as furniture and 1 restaurant. We are working with our tenants, but many are out of funds and may not be able to survive if they do not open soon. Most have received little or no government assistance as they thought they might. We are asking you to please petition the state to allow San Joaquin County to open up quickly for our merchants' sake. Thank you. And 2 last comments I have from Tiffany. She writes, my name is Tiffany Pinella, and I live in Stockton. I'm writing this message to let you know that I am in support of opening all county businesses. All businesses should be deemed essential, not just those run by large corporations. I urge each and every supervisor to open the county for business. As a small business owner who has been unable to operate during this shutdown, I know what it is like to pour one's heart and soul into a business only to see it slowly slip away. Our county relies upon each and every one of us and the revenue we generate. We cannot continue the shutdown. As it is now, we are seeing our customers being stolen by similar businesses in other counties that are allowing those businesses to operate. We may never recover from that. Once again, I urge you to vote to reopen the county and allow all businesses to operate with the necessary safety protocols in place, of course. And the last comment is from a nursing action group who writes, Board of Supervisors. This note is from a group of ICU and inpatient nurses and express our gratitude to you all, working every week and listening. At the same time, we recently came across the pay packages of physicians as the county hospital have 7 in top 10 paid employees in the state, with more physicians receiving more pay than last year. This year, there are 11 in top 15, and both total amount and number of physicians have gone up further with more recruitment. Last year, CEO responded, San Joaquin General Hospital has few surgeons, and now they have 3 more, and all are in million scale. The institution is losing $25 million every year since this new package structure was initiated. We see 3 surgeons performing a single surgeon duty, and oversight is missing. Do you plan any action? Please update us on RFI 2. Best. And Madam Chair, that concludes the comments that we've received.
Thank you. I'd like to thank the members of the public for taking the time to provide their input, and also to remind everyone, if you're watching on YouTube and you submit comments there, they will not be made part of the official record. But if you continue submitting emails to the clerk of the board during the remainder of this meeting, we will make every attempt to get your comments read, your questions answered, and they will definitely be entered into the official record in their entirety. Before we move on to our consent items, minutes, I'm going to call for just a very brief break. We're going to try and be back here absolutely no longer than 10 minutes, but let's try and keep it around 5, and we will be back here very soon. Thank you. Okay, everybody, we are back. We are going to move on to minutes. We have two sets of minutes from May 5th and from May 12th. Unless there is anyone feeling that we need to make any changes or additions, I am looking for a motion and a second to approve.
So moved.
Second.
Okay, we have a motion and a second. Please cast your votes. And those minutes are approved 5-0. Thank you. We have no appointments for approval this date. So we are going to move on to our consent calendar. Items 1 through 25. Is there any item that supervisors feel needs to be pulled for any specific reason? Okay. Then we are looking for a motion and a second on consent.
So moved.
Second.
I have a motion and a second on a consent calendar, items 1 through 25. Please cast your votes. And that is approved 5-0. Thank you. On to our first discussion item, which is on general government. It is to approve the San Joaquin County Public Health Services Facility Replacement Project at an estimated total project cost, approximately $25.3 million, approval and adoption of plans and specifications, authorize advertisement of project bids, and set a bid opening date of July 3rd, 2020 at 2 p.m. This has been a long time coming, years and years and years, decades.
Yes.
So I'm pleased to see you here today. We have Marcia Cunningham, our General Services Director, and I'm going to let you kick it off and introduce everyone else that's going to participate in the presentation.
Perfect. Good morning, Madam Chair, Board, Council, CAO Nino, Marcia Cunningham, General Services Director, and we're just as thrilled to be here this morning to be sharing with you the status of the Public Health Services Facility Replacement. As you noted, we have several recommendations, and I won't read them again, that we will be presenting to this board. Our presentation overview, we're going to give you an update on the project process that was followed as we went through this project to get it to our $25 million that you're seeing today. We had a set budget, and we stayed within those parameters of the development of the site, what design vision went into it, what were some of the key components of that we looked at why we were envisioning the site, and what the structure would look like. From a planning perspective, the site assessment, planning options that were taken into consideration, the programming, costs from a budget, a funding source, and also go over the lab business case and the justification of including the lab along with this project, and then give you a little sneak peek of the very important dates that go along from a schedule that everybody likes to hear. So with that, at this point, I would like to introduce Stephanie Swain, Associate with Dreyfus and Blackford, and she is our project manager on this project, and she's going to begin with going over the master plan and programming.
Good morning, Board of Supervisors, County Administrator, and County Council. I have to kind of hold back my excitement to be here today because it's been, I think, 3 years in process working with this phenomenal team with a lot of apprehension of whether we'd move forward. And so to be here with some of the visualization, to talk about where we've been in the past 2.5 years with this team, with the efforts that we've taken place in the last year and a half, and what the next steps look like, I'm most excited. I'm very excited to be able to be delivering this to the county and to those that the Public Health Services building will serve. So I'm going to jump through a little bit of a recap of where we have been. I saw you all about 1.5 years ago, so some of this will look. The slide that's in front of you right now is representative of that first phase of work we completed, which was the master plan and program. The important facets of this slide really point out that master plan and program is a series of phases, which began with discovery, assessing, programming, the planning and design, and then ultimately report and approvals. Each of those phases, critical, they build upon one another, but one of the bigger overarching critical aspects of this was engagement of the appropriate stakeholders from the beginning, which you see on the left there, filtering through all of the phases of work. This group of stakeholders was a cross-section of your subject matter experts from the public health service level, the healthcare services administration team, and then our guiding leaders, obviously, with capital projects. So I think that last time we were in front of you was for approval for this master plan to then move forward into design and engineering phases. This snazzy diagram in front of you here is really just a quick glimpse into our Dreyfus and Blackford's design process. You know, we gathered all that information in our planning, master plan and programming phase, and this next phase was about design and engineering and building a set of constructible construction documents to be able to make this building come to life. So that first initial phase of this process required us to sit down and say, did we get it right? Did we hear all of your concerns about some of the conceptual ideas that we'd come up with? It is a linear process, but clearly it is reiterative that we will go back and forth because we're not always going to get it right. But at the end, there was consensus above all with all the stakeholders for us to launch into the detailed design of those construction documents. So I've talked a lot about the stakeholders and the criticality of their involvement from beginning to end. So just to note, those stakeholders, obviously general services, capital projects, the champions for keeping us moving along on this effort. Healthcare Services Agency, Greg Deirdrick, his unvarying support on this lab and the business case and really, bringing all the pieces together. And then our public health services team, the boots on the ground, the ones that have been at that table with us every step of the way. There's times we lost faith, but we brought this through. And again, this was all done collectively as one stakeholder group. So we've talked a little bit about where we've come from. We've talked about the stakeholder group, and let's talk about what the vision for this project was. I think you all are all aware that the Public Health Services building is roughly 6 years old, has a few deficiencies, we might say, from just a building standpoint and safety and security. So overall, the vision for this project was to create that welcoming, positive, and safe environment, not just for the community, but for the staff that are working there. Safety and security was one of the #1 driving forces on a lot of the decisions that were made on this project. We know that this facility will increase agency collaboration while delivering that effective and efficient services, again, to those that receive the public health service care, and then ultimately developing an integrated and flexible workplace that could improve the delivery and operations. The key word flexible there because we moved into this building or planned this building with an FTE that can expand by about 15 to 20% without changing a building footprint, using workplace standards and revisiting some of the county standards that have been developed to date. So all of these goals here, these visions, every decision that was made by the team, every step of the way, we use this as a filter. Did it align with the guiding principles to get us to where we are today? So building siting, I want to refresh your memory. The last time I was in front of you, we talked about the proposed location for the new building. So on the left-hand side there, you'll see that blue outline, which was originally the proposed location for our building. During the master planning and programming phase, we had assumed a greater number of functions would be coming into this building. That was refined to align with our budget, which took our building from a 3-story building down to a single-story building. So as we moved into design and engineering, we had all of our engineers on board, one of which who's been a member of your community for 60 years and has sat on the benches in public health services waiting for his immunizations. So he's happy to see them go, I will say. We worked with that team to look at the site and say, have we made the right decisions with some of the refinements that have been made to our building? So What we have done is adjusted the location. We are now looking at a single-story building, which we've tucked back further to Della and East Hazelton, as you can see on here in that top right blue three-dimensional block on the site. Existing buildings shown there in the pink, and some of the pros for this approach allowed us to alleviate the relocation of your electrical services to the site. When we had a three-story building, if you look at the economy of scale of moving such a massive service, made more sense. So we're able to leave that where it is, existing location. In addition to that, we have a lot of really nice mature trees that are on that Della and East Hazelton area of the property. So from day one, the shade that we will be able to provide to the building for energy savings will be there. And then also being, sensitive to the future expansion of any buildings on this site. So we left that space on the Wilson Way Hazelton corner open for future expansion, which makes more sense for a larger building given the scale of buildings on that side of the property versus those checked back on Della. So let's take a look at what the site looks like with our new building. So the area in blue is the building. We do not actually have two buildings. It sounds like some believe we may, but it is a lab and admin space that are connected by a shared entrance into the building. There are separate entrances for staff and public, and we'll look at that a little bit further, as well as separate parking, secure parking for both the staff and public using the space. Again, we've mentioned bringing that building back into the corner of Della and East Hazelton also allows for great visibility onto the front door, the entrance of this building. Specifically from the street, so hopefully we can prevent any unwelcome overnight visitors in conjunction with the perimeter security fencing that we will have for this property. So this close-up is of the entrance to the new Public Health Services building. This slide here is representing the new color palette that we worked specifically with the county team to develop a standard that would be used on all future county projects coming out of this area. The materials that we've used are resilient. We have glazed brick, which is actually sourced and handmade down in Watsonville. We've got metal panel and then the plaster systems. These are all resilient, very durable systems that will respond to the county's 50-year desire or 50-year building life for this particular space. The colors that we used here, our overall concept really pulled from your location, the waterways, the blues from the Delta, and then, some of the more burnt yellow that you're seeing in there, kind of hearkening the Delta reeds in the summer when they are just sun-torched. So using that, and again, working with your county team here, using the logos to pull from, we're really excited to have this move forward on all of your buildings to come. So let's take a look at some more of the visualization. So I've mentioned that separation between the staff and the public. So this is really the public straight on into the building here. We have a great amount of outdoor space, which will allow for family overspill during any types of elongated waiting periods. You've got that yellow metal panel that's separating the staff from the public side, and that design that you see on there, it's a little hard to tell here, but we've pulled that from the Thule reed from the Delta as well, and I think Ziena was the one that approved that design, so I'm happy to see that move forward. Take a look at the staff side here. That lab onto the left there with your staff entrance aligning to that metal panel as well. We do have separation from the lab and the admin building, but again, it's all connected by the interior of the circulation for the main entry points to the building. And let's take a look inside. So public lobby, we've created a controlled environment for the public in this space. I know in the existing building, there's, I think, about 5 different entrance points in which public can get into the building. So we've got one main entrance, there's the main exit, and then there's a secondary exit for those who are on site for communicable disease testing. We also have a subway to be able to pull those individuals out of potentially those that might be there with a newborn, for birth certificates, et cetera. Lots of great light in the space. Again, resilient, durable materials, things that will stand the test of time here. Take a look, looking outside from that public area there. So again, we mentioned that overspill from the interior space to allow for a little extra waiting space if necessary. We didn't want to oversize the waiting area, and we live in such an amazing climate that we really can utilize those outdoor spaces for flexibility. We'll take a look into the office space. We mentioned earlier the flexible office environment, adaptable floor plate. We were very conscious going into this that we weren't building a robust floor plate that was going to have 50% vacancy. We wanted to be very prudent to that. So we looked at the workspace, the floor plates or the workspace footprints themselves to see how we could standardize that in a modular environment, as well as using the structural systems to keep the bays open so we don't have columns to compete with, which will allow for growth over time. We have a combination of the workstations you see here and the hotel spaces. Now, we know we find ourselves in a different time as far as COVID-19, and once we get into procurement of furniture, we will absolutely look at solutions to maybe we raise some of these panel heights, but maybe we look at doing glass for those to keep the transparency and openness, but to provide that added protection. Excuse me. So let's take a look into the lab. You may all be familiar with how the lab currently is broken up into several different buildings at the Public Health Services building today. Of which you have to leave one building to go to, components that add on. So what we've done here is we have one great space, this open lab, transparency, the visual connection between the entire lab with all those critical services, your tuberculosis, your rabies, your darkroom, all flanking that left side on here. So workflow efficiency is increased exponentially in this space here, as well as all the great natural light we have in here. We do have a raised foundation here, so there's a sense of security as well without people being able to see into these windows. And then where this particular window lies is it's kind of true north, so you do have a protection wall that is out there as well, so you won't have no people will be walking by these windows essentially. And then shared space between the lab and the admin, obviously our break areas. So this is just a rendering of our staff break area. We do have an adjacent outdoor covered space, lots of great natural light throughout the entire building footprint. And what this allows for is flexibility of use as well. So this could also double as a meeting space for individuals in the building. Sorry, jumping ahead here. Uh-oh. There we go. As well as the exterior space, which does have a covered patio. You again see that metal panel screen, and then we also have a security fence that's outside of that as well. So again, I can't thank the Public Health Services team nearly enough for all of the work and effort that they have put into providing us the information to design a space that meets their needs. The undying support of the capital projects team. We've had some hurdles. No project goes smooth, but again, very happy to be at this point to present to you and hopefully move on to that next phase. So now I'll turn it over to Daniel Moore.
Good morning, Board of Supervisors, County Administrator, County Council, Clerk of the Board. At this juncture, the presentation will be transitioning to a high-level overview of some additional project details, including project financials, the business case for the Public Health Services Biosafety Laboratory, and some upcoming date milestones for the conceptual project schedule. So as we're looking at the current slide, this defines the building program that we've discussed so far, as Stephanie covered in a very visually exciting conceptuals for the project. This really defines the square footage. The total net square footage for the project is 31,000, and that's broken up by 25,500 square feet for the Public Health Services Administration building, and then of course the 5,500 for the Public Health Services Lab. We also had a subtable there to detail that this is a replacement facility and the current building headcount per PHS is about 88.8. Of course, the new building would be able to capture existing staff while allowing flexibility for future growth. We estimate a max capacity in the building of 113, so there is opportunity for growth in that regard. So the current slide we're looking at now features a breakdown of the total estimated project cost. As we see there, the estimated cost for the Public Health Services Administration building component is $10,740,000. For the Public Health Safety Biosafety Lab, it is $5,970,000. And for the project site work and future demolition activities, we estimate $5,370,000. For the project soft costs, we estimate $3,270,000 for items such as project fees, consultants like our great partners from Dreyfus and Blackford, fixtures and equipment. The sum of these line items equates to a total estimated project cost of $25,350,550. As detailed in the note at the base of the table on this slide, we also performed a comparison analysis for estimating operating costs of the new building at this time. And based off of our analysis, the new facility would reduce utilities and operating costs by approximately $41,000 per year. That being said, between now and when the project and the final building opens, we'll continue to work with our team and colleagues in facilities management to evaluate additional opportunities to reduce operating costs. So the current slide details a summary of the proposed funding sources for the conceptual budget for this project for the construction. Specifically, this includes $1,350,000 that has been allocated to date from the Public Health Services Trust account. It also details $21,160,000 from the capital outlay. Now, a key detail here, this amount is inclusive of a previous funding transfer of $1,162,738 that was made from the Hospital Enterprise Fund as part of the fiscal year 2018-19 year-end report. Also on that list is something Healthcare Services and Public Health Services staff helped us with by identifying 3 county-owned public health services clinic properties as surplus that are currently being marketed for sale and are estimated to garner $1,050,000 from such sales in the marketplace. That evidences a remaining funding gap of approximately $1,790,000 for which Public Health Services has proposed to utilize estimated fiscal year 2019-2020 budget savings. Now to give some details on the viability and business case for the Public Health Services Biosafety Lab component of the project, we have Director Greg Diedrich.
Thank you, Daniel. Under Title 17 in California, counties are mandated to provide public health lab services. And if we do not provide the public health lab services directly, it does not eliminate all of our costs. And our lab is funded by earned revenue for the services we provide, realignment funds, grant funds, and ultimately the deficit is funded by a county general fund. If we're able to outsource our labs, and I have to put the emphasis on if, we believe in those labs strictly for our mandated population county citizens for the scope of services we provide now, we estimate that the cost perpetually would be between $1.4 and $3 million. And that's based upon the low end published rates in the Bay Area versus contract rates where actually Sacramento does provide contract lab services. That would be at the higher end of that. It also includes us packaging and compliantly sending it to those labs. So that's the estimated cost if we were to outsource it. And again, I don't think, given our volume, we could immediately outsource. One of the good things that we've done over the last 2 years is we worked with Stanislaus County in a joint powers agreement with them, as well as a very much expanded partnership with San Joaquin General Hospital to not duplicate lab services. With those partnerships and economies of scale, this year we've moved from a net county cost of a couple years ago being about $1.6 million, it should be under $900,000 this year. So looking at that delta between spending $900,000 versus $2 million, it looks like it's a good investment that we stay in the lab business, and that's just what we can quantify. And in today's environment with COVID-19, I think there's a lot of intangible costs that we can't quantify, having the local control, the surge capacity, and most specifically the superior turnaround time we have for some of the testing. So I think we have a strong business case to be in the lab business perpetually, but I know it is a large county investment, $6 million. If we do invest it, we will be there long term. But I believe both what we can quantify and what we can't, it is a solid investment for public health in our county and the region.
Thank you, Greg. We'd now like to provide a high-level overview of some key upcoming date milestones from the conceptual public health services construction schedule. As we see on the screen, we're currently targeting an August 2020 start to construction activities, for which we'll be planning a groundbreaking ceremony to commemorate. So I'm sure you guys will be very excited about that. With a 12-month projected construction project timeline, we'd have a goal of completion in July of 2021 and occupancy of the new public health services facility in August 2021, or approximately 30 days for the construction completion aspect of the project. It should be noted, however, that the project dates as represented are dependent upon standard market conditions, and as we all know, things are anything but normal. The global COVID-19 pandemic has created a number of industry uncertainties associated with living in general, yet alone construction. That being said, we as a project team will continue to pursue timely project development and delivery approaches so that we can deliver this project as represented and really create a strategic infrastructure addition to the local region in lieu of this issue we're all dealing with locally and globally. So at this time, we are recommending that the Board of Supervisors, by board order, approve the San Joaquin County Public Health Services Facility Replacement Project at an estimated total project cost of $25,350,550. Approve and adopt plans and specifications, authorize the advertisement of project bids, and set a bid opening date of July 3rd, 2020 at 2 p.m. That concludes our presentation on the Public Health Services Facility Replacement Project. We are available to answer any questions you might have at this time.
Thank you. Supervisor Patty?
Thank you, Madam Chair. Through the chair, if I could get Mr. Dietrich to come up, I had a quick follow-up question for him regarding the laboratory. I know that in the past we had talked about laboratory and the great services and that partnership, the JPA with Stanislaus. That's fantastic. It really looks like that's grown into a great relationship and beneficial for both. Is there any opportunity to expand the services that the laboratory would offer? Because I know one of the hardest things is having that lab, the lab physician or doctor or technician or the senior steward of the laboratory operation.
So that's one of our concerns. Mike, our former lab director, actually in the fall took a job as the state of New Mexico lab director. The lab directors are in short supply. We do have a compliant lab director that has the title now. We are working with the state. They have a program that allows other people with the PhD but lacking the bench experience in a public health lab to acquire that experience. But for the joint powers agreement with Stanislaus, it is a way for us to further share our overhead and broaden that some economies of scale. And they are getting a good value for that because they are saving some money as well. We are also a regional lab, so beyond Stanislaus County, where we're more kind of all in sharing the deficit, we do provide lab services for a 7-county region. Not a lot of volume there, but we are looking at other potentials to expand the scope of services within public health to mitigate communicable disease, as well as to further that spreading of our overhead to make sure that we are good stewards of the public money and driving down consistently the net county cost for operating the public health lab.
But the question is specifically, any opportunity to expand to other counties to offer laboratory services?
There was some dialogue a year and a half ago in regards to Merced County. Merced County still is having a public health lab, much smaller volumes, obviously overhead. I think they're looking at it from the terms of local control and having it, but fiscally, especially as we move into an economic downturn, can they continue that? That might be a region we expand into. Fresno County had some issues with their lab. It actually had a flood and some other issues. I don't think they're back open yet. So I think they might be looking at what they might do. Will they expand down toward Tulare or rebuild their lab? And if they do that, is there an opportunity for Merced to either partner our direction or partner down south? But it is something we looked at because I know other counties have gotten out of the lab business because they had high cost and could not mitigate those costs. But I think in our region, it is an asset that we have. And as I mentioned, there's a lot of intangibles. But we will continue to be the best stewards of the public money and drive down that cost and look for those opportunities.
No, I understand that, and I appreciate the cost savings. I'm wondering, the reason why I'm asking is if there's any potential for us to bring in other county services, because we do have a lab director, unlike what other areas might be facing a shortage of. Would our laboratory be big enough if we were to expand other services and therefore have a cost benefit and savings to adjoining counties?
I think the lab, as it's proposed, the 5,500 square feet, is big enough. As Daniel and Stephanie mentioned, right now we're kind of spread into 3 different areas, so it's inefficient. As you know, when COVID hit, we ended up expanding to 7 days a week, so that might be our opportunity if we continue to have a lab volume. Even though we have enough square footage, if we needed to continue to expand, it might be a second shift or alternating weekends to provide those other services. When I mentioned the partnership with San Joaquin General Hospital, this is where we're not duplicating services, as well as some of the services that San Joaquin General Hospital did might have been under a capitated agreement with some of the managed care plans, which means they have no marginal revenue. Under the public health space, with our contracts with Health Plan of San Joaquin, we are actually able to build marginal for some of those labs. Some of the things that we'd like to expand more onto is in the sexually transmitted disease, because that actually, when we run both a CT and a GC, a chlamydia and a gonorrhea test, actually when we run them together, it actually leaves some margin on the table for us. But some of these, we're becoming back in June for the fee hearing. What we did in the last couple of years is when we were working with another government entity or an individual taxpayers, we charge them our cost rates. But when we go out and if we want to expand and seek additional insurance contracts, that's where, similar to the hospital, we can have a negotiated rate, which could be above our actual cost. And that would further diminish net county cost subsidizing the lab.
So the lab proposed, if I understand correctly, would be adequate for not only what we need now, but any future increase in demand and services. And that might be accomplished by a split shift. But you like where we are, even if we need to expand?
I think we're solid there. If you looked at the diagram, we are still reusing the biosafety level 3 lab, which is kind of a trailer. It's being repositioned. So it's still outside, and the reason we're reusing that is because of some of the costs that would be required to actually bring it within the building. But I think we have sufficient capacity, and it would be much more efficient because, as I mentioned right now, the lab space is split into kind of 3 portions within the building. Then we have the clerical space that is also kind of pieced together here and there. So we'll be more efficient. And you saw the interior of the lab space. It is a brand new design, and it is to current standards.
Excellent. I'm still not getting an answer. So
I do believe it is sufficient for now.
If we need to expand in the future because of more partnerships, yes or no, you think it's adequate?
I do believe that it's adequate, sir.
Absolutely fantastic. Thank you. I appreciate it. And I know that you've got your fingers on the pulse of a lot of things, and thanks for sharing all that info. Thank you. Madam Chair, just through the chair, I'd like to have a question for County Council. What could we do as it comes to the bid process for the construction? I know that in past conversations, in the city of Richmond had a 50% mandatory local hire. And I know recently when we built the county hospital, we accomplished a much lower margin of hiring of local contractors and staff to build that. what could we actually do to get to a 50% threshold as a strong recommendation, not necessarily legally imposed, but a stronger, perhaps maybe some stronger wording similar to than what Richmond might be offering?
Well, I'd be happy to look at what Richmond's programs. One of the issues that we always face here in the Central Valley is having sufficient tradesfolk for that particular need. So it all depends, or a lot of it depends on how you define local when you start your local hire.
Mm-hmm.
If you define it by a small number of zip codes within city boundaries, you define it within county, you still may run up, even if you go countywide, and that's what we've seen with the other recent large construction projects for the county, is that certain trades weren't available within the county. I would offer, and I have not looked at this recently, but I would offer that in the past we've done just about everything that we could as far as local hire. But as I said, I haven't looked at that recently, and I'm happy to go back.
And I think we could perhaps put a new, fresh set of eyes on it. In case in point, when it came to the county hospital, we had a local contractor, Collins Electric, and other local electrical contractors that were bypassed, and that would have brought a big workforce into that project locally, and they weren't. And I'm sure there's a bidding process that may or may not be a factor, but here you've got a company this is right in their wheelhouse. Bachman Woody is another one. And they didn't have the opportunity to do that job, and that would have been a tremendous boost to that 50% desire.
Certainly it would have. The public contracting, public works statutes, or the statutes that govern the construction of public projects like this are very specific about lowest bid.
Mm-hmm.
And so leaves us very little room to maneuver in there for other qualifying factors, but it's something I'll work with purchasing.
So to that point, we had redone our purchasing, when Mr. Drake was here, we had redone our purchasing policy and allowed local companies to match if a lower bid if it were an out-of-town company bidding on whatever the service was or the product. So I wonder if we could weave in something like that. And again, whatever's legally allowed, but if we could weave into something, if there's a provision that would allow a local company to match the lowest bid, not cost the county any more money, but at least that local company has the opportunity to match a lower bid.
We'll look at that, Supervisor.
All right, thank you.
Thank you. Supervisor Wynn?
This goes to Mr. Diederich. Where did he go? There he is. Okay. Following along with Supervisor Patty's questions, one of the things that I think we've seen through this pandemic, certainly with the testing portion of it, is the need for additional testing, et cetera. And I know our lab stepped up and increased the numbers. So where would we stand on that? I know we're a year out on this particular facility, but when we're talking about, or at least a lot of pundits or experts are talking about a resurgence in the fall or whatever, and obviously we won't be ready for that outbreak if it occurs, but in the future we may have other situations very similar. Are we considering in not just the plan of the building itself, but as far as touched upon with staffing, et cetera, and maybe equipment and the variety of tests that we can complete, are we expanding our view, so to speak, in regards to the future and the needs for additional testing, certainly with an additional pandemic that may occur sometime in the future?
We're definitely looking at that. Obviously, there's 5,500 square feet, and part of the reason the lab looks relatively more expensive is because of the furniture, fixtures, and equipment that goes in there, where we're using a lot of our equipment. What we're limited right now when we've talked about our ability to do between 60 and 144 COVID tests per day, it's really limited by the equipment we have. The equipment's not overly large. There could be more equipment brought in. When we surge from 60 to 144, what that really means is we're delaying other tests and prioritizing the COVID test. But we definitely have an ability to expand the equipment and the capacity within the lab to, if we needed to ramp up and to do 1,000 tests a day in there, there's probably the potential to do it. Obviously, it has additional equipment costs that are not included in the current budget.
Okay, but as far as the facility goes and the square footage, we would have the ability to locate that additional equipment.
Yes, we would. And, additional equipment gets us into, I know we, via grant funding, we have gotten into genome sequencing and other things that are kind of a little more cutting edge.
One of the things that, with now Congress talking about an additional package of $3 trillion or whatever, it would seem somewhere out there would be some additional funding, especially since this is a healthcare crisis, that there would be money available for additional testing equipment or space or whatever we want to talk about as far as renovation, or at least in this case, a new building. Are you aware of anything that's been discussed in Congress or is available to supplement our funding?
There definitely has been some funds coming from the feds. I believe on the agenda today there was an item that we're acquiring that we were using for communicable disease tracing and funding some nursing positions. But there definitely has been more in the pipeline. And as I mentioned, we try to leverage grant funds to fund some of the equipment. But there's also some other funds that are flexible that we could use for labor, IT, or our lab equipment.
Okay, good. Thank you. And a question for Daniel. The expansion of this facility, of the public health portion itself, what was the number again that you said we could achieve if we needed to expand our footprint, so to speak? Was it 114?
To 113 FTEs.
Okay.
Oh, for staffing, yes. Day one will be 89, but it has a maximum capacity of 113 within a new facility.
So we do have room to grow?
Yes, sir.
Okay. And then the last thing for Stephanie, I learned a new word, ideate. Is that a word?
It is. That's how we start everything, is with ideation.
Okay.
Yeah. I didn't make it up, I promise.
Okay. Well, I was going to say that was a very creative word, but I appreciate it. Thank you.
Supervisor Elliott, you have questions?
Yes, thank you, Chair. So I know we've been talking about this for years, and this has been a project that you have pushed from the beginning. So I appreciate your perseverance on this to make sure that we were able to bring this to fruition here. And it looks like a lot of thought has gone into it as well. It appears now that the location for this building is going to be in the parking lot that currently exists. Is that right?
That is true. So we'll have some challenges during the construction phase.
Yeah, I was just
going
to ask about that.
Tearing down the old building.
Mm-hmm.
Right. So where will people park while they're...
Yeah, I will say we have the privilege of having a very large site, which is allowing us several phases. We'll have temporary parking close to Wilson Way. We'll have some street parking as we phase through. The whole goal is to maintain the original building full function operation through the entire construction period. So the contractor is going to have a puzzle to solve, but we've been very clear in delineating each of those phases. There's about 5 to completion.
Okay. And then following on with Supervisor Wynn's questioning about the wording here, I noticed there was some mention, and you talked about it as well, hoteling workstations. What does that really mean?
Those are simply a smaller footprint workstation that allow for the staff who are maybe out in the field more often that come back just to do reporting on their computers, less real estate. So I don't have to have an entire workstation just to do that. So it allows us to get more people in the building. Again, I do know that we're up against a unique time with our pandemic, and we may need to reassess that, but it just allows for a smaller footprint, greater flexibility of people in the building.
Okay, so that's primarily for those people who will be working outside the building. Correct. For the most part, and just need some place to work when they...
A touchdown spot, absolutely.
All right, great. Thank you.
Thank you. I'd also just like to touch on, Mr. Diedrich, in terms of the additional equipment that perhaps there is funding available right now. If it is equipment that could help us ramp up testing and any other services in relationship to COVID-19, I would say let's put in the application. Let's bring in that outside money. Let's spend those dollars on beefing up our COVID response, which then can be used down the road for all of our public health responses. So I think healthcare is an approved expenditure for quite a bit of the funding that we have received, and so I'd like to see that earmarked as much as we can to benefit public health. I think if there's one thing this pandemic has shown is the critical importance of public health. That's not going to go away anytime soon. The tracking and tracing, all of this, it hinges on our ability to test a large percentage of our population, not just once, but fairly regularly, and track and trace. So let's make sure that we build that capacity in as much as we can. In terms of the local hires and the jobs, how many jobs do we think are going to be created through the construction of this new facility? Do we have an estimate?
I'd stop short of giving an estimate. We're at the very genesis of the next phase of this, which is the project execution plan for constructability, which, of course, we're going through a bid for a trusted partner, but we could definitely start to forecast that and share that information when we have more updated stats.
I'd like to see that in the updates coming to the board. And I will second Supervisor Patty's request to County Council. I think we should look into as much as we can do as possible. I realize everybody's economy has been hard hit, but we represent the folks that live in San Joaquin County and the economy here. And whatever we can do to either build in local procurement plans and also local hire for this. It was really disheartening to see that great, wonderful big project at the hospital, and provided a lot of good paying jobs to a lot of folks that lived in Sacramento County, to be perfectly honest. And I realize we're limited by the trades that are available and which building trade members will forego driving over the hill to participate in projects like this. But let's at least see what we can do on our part to make sure that as many of those jobs, as many of those contracts, procurement contracts as possible, stay here local. Okay, are there any other questions?
Thank you, Madam Chair and board members. I appreciate the dialogue in regards to the lab. Greg and I have had numerous conversations, and as he opened up, and I very much appreciated that, some of our current agreements are not covering all of the costs. Lab operations are not cheap. And so, given as a result of COVID, the value that that lab has brought locally, and as Madam Chair, you just mentioned, we've looked and we will continue to look to see if of this roughly almost of the total 25.3 million, 22.9, almost 23 million of it, this board has 100% discretion over. Those are tobacco capital project funds along with general fund dollars. When this county hit the recession back in 2008, essentially this county utilized 3/4 of what I recall. And they essentially took these dollars and essentially balanced the budget with these dollars for a few years. And so I want to make sure the board knows this. I have truly appreciated this board's desire not to do any kind of public financing, because thank goodness this board had that foresight over 2 years ago to make that determination that it would not be affordable. Who would have anticipated our fiscal situation would be where it is now? Because it is not looking good at all. As Mr. Dietrich mentioned, a lot of the dollars that fund both public health in the lab are realignment dollars. Those are some of the dollars that our governor mentioned last week, Thursday. that they're seeing significant reductions. Those are sales tax dollars. Those are vehicle license fee dollars that essentially pay for public health related services. So, Madam Chair, as you suggested, I don't believe at this point there's separate grant dollars to fund a project, but as long as this board is in support of it, and I took it as your action last week, we're looking at potentially a portion of those CARES Act dollars. The problem we have right now, though, is right now, from what we could see from the federal guidelines, that just encumbering the funds, not actually incurring the expense, may not be a valid use of those dollars. So we will continue to monitor that, because if that ends up not being the case and we can use our CARES Act dollars, you will hear as one of our recommendations will be that we would fund, instead of using general fund and flexibility for other related projects, some of those CARES Act dollars, to fund a project that has been of great value and we anticipate will continue to remain of great value, not for just this county, but as Greg mentioned, one of our largest contracts, Stan County, we're currently not recovering all of our costs, are benefiting even counties outside of San Joaquin with some of the, our services. So we will be looking at some of the CARES Act dollars to use in replace of the roughly almost $23 million of essentially dollars that this board would have had in the event, say, in 21-22, when I really believe our budget is going to be extremely difficult to balance as one-time sources to balance it. So I just want to make sure this board knows that we will be looking at some of those CARES Act dollars to possibly fund a portion of this project. But just initially, because the project won't be further along, it may not be a viable option. But I just wanted to share. Great.
And just in a full sense of transparency, as Stephanie mentioned, as we got into the master space planning, we were looking at a 3-story building that would have brought back everybody within public health that's in the lease space, as well as other aspects of the agency. And then based upon the budget, we have a 1-story building that is primarily replacing everything that's in the Hazelton building. But as you know, the board had a balancing hearing a month ago having to do with the Hazelton clinic. There is not an FQ clinic space in the new building, so I just wanted to be fully transparent with that.
Thank you. Any other questions? Then we are being asked to approve the San Joaquin County Public Health Services Facility Replacement Project at an estimated total project cost of $25 million. Approval and adoption of plans and specifications. Authorize advertisement of project bids and set a bid opening date of July 3rd, 2020 at 2 p.m. For a motion and a second.
Make a motion to accept the report.
Second.
Second? Right.
Excuse me. So the motion was to accept the report?
Accept
the recommendation?
Recommendation,
Yeah.
yes, sir.
Yeah.
Right, to approve the recommendation.
Recommendation, I'm sorry.
Yeah, it's to approve as presented.
Yes.
So it will include the approval of the replacement project at the amount of just over $25.3 million. It will also approve and adopt the plans and specifications. It will authorize advertisement of the bids, and it sets the bid opening date. That is the motion.
I still second it.
Okay. Motion and a second. Please cast your votes. And that is approved 5-0. Congratulations. Okay, next we're going to move to COVID-19 related items. The first one is a consent item for general government. Unless somebody feels that needs to be pulled from, actually, can we take both of the consent calendars at once, or?
Yeah, there's 3 items that can be approved in one motion.
Even though they're broken out into 2 areas. So one is under general government, 2 of them are under health and human services. Unless there's a reason to pull them from consent, I will entertain a motion to approve the COVID-19 consent calendar.
So moved.
Second.
I have a motion and a second to approve the 3 items on consent. Please cast your votes. and consent is approved 5-0. Thank you. Okay, on to our weekly discussion, general government discussion on assorted COVID-19 pandemic issues, and we have the ability to provide direction or adopt orders as necessary. So this week, we're going to kick off with County Council Mark Miles first.
Thank you. Through the chair. During the last meeting, there was a request or expressed desire to communicate with the state regarding the ability for the county to exercise some control, greater control over the reopening of the economy locally. To that end, I did some research on what some of the other counties around us have done, and I have prepared a resolution which I have provided to the board. I've also discussed this with the city attorneys for the cities located within San Joaquin County. 6 of the cities either already have, I believe Escalon had their meeting yesterday and took up this matter. Lathrop, Lodi, Manteca, Ripon, and Tracy are meeting this week, some of them this evening, and will also be joining in this resolution. So it's presented as a joint resolution between the board and the cities to the governor, asking that the governor, or petitioning the governor for greater authority to develop guidelines and implement local directives necessary to allow individuals, businesses, and schools to resume activities in a manner that does not menace the public health. Of course, this was drafted last week, and since last week, the rules have changed. A lot of the discussion was in the resolution centered around the ability of the county to meet, or the efforts that the county had undertaken to meet the variance guidelines. Those paragraphs are not particularly relevant any longer. So I think there's 3 options that the board can take. One is you could say that you're not interested in this resolution whatsoever. Send me back to the drawing board and we'll start over. The other version, you could accept it the way it is. I don't think that there's any harm in having a discussion in there, although it's not really relevant at this point. My suggestion would be that on the second page of the resolution, there are 6 paragraphs that reference the variance criteria, and I would recommend deleting those 6 paragraphs. And they're the second paragraph through the 7th paragraph on page 2. So it starts with the paragraph that says, whereas the county of San Joaquin has exceeded the testing capacity, down through the paragraph that reads, whereas the county of San Joaquin has established epidemiological stability. I would recommend that deleting those paragraphs, and the deletion of them I don't think does any harm to the resolution. It still stands well and conveys the message to the government.
So can you, one more time, which paragraphs are you recommending deletion?
So it starts on page 2, the first paragraph, whereas the county of San Joaquin has met all of the criteria within its control. I recommend that we leave that paragraph. The next paragraph that references 1.5 tests per 1,000, I would suggest that that paragraph be deleted. The paragraph that addresses 35% hospital surge capacity, I would recommend that that be deleted. The paragraph that addresses issuing clear directives to all employers and essential critical infrastructure work sites. Actually, that paragraph could stay in. That is an action that we've taken that really stands independent of the variance categories. The next paragraph that addresses 15% shelter capacity, I would recommend that that paragraph come out. The next paragraph that addresses the assisting skilled nursing facilities in acquiring PPE, I would recommend that that come out. And then lastly, the paragraph that states that the county has established epidemiological stability, I would recommend that that paragraph come out.
Okay. Questions from the board?
Yes.
Really?
Thank you, Chair. So now, are the other cities going to modify this, or is everyone planning to adopt this the way it reads now?
Well, what they have before them, I've not spoken to the cities since the governor made the changes yesterday. So what they have before them is the same document. However, if the board makes these changes, I will, as soon as possible, provide them with a revised document, and then they can make their own decision about what they present to their city councils.
But have some of the city councils already adopted?
I understand that Escalon was to meet yesterday. I don't know what the outcome was of their meeting.
Okay. And actually, in light of the revised wording now that is in the new Phase 2 movement attestations here, you're right. We probably don't need that. And I don't think it will hurt any the overall meaning of the document there if we take those items out. One thing I would suggest we consider adding in is over in the first therefore, well, it's the only therefore be it resolved paragraph. At the end, it talks about crafting and implementing local directives necessary to allow individuals, businesses, and schools to resume activities. I would suggest we consider putting in individuals, businesses, churches, and schools to resume activities.
We can certainly do that. Instead of churches, to be more broadly, houses of worship or worship centers.
That's fine. Houses of worship, it's the same thing. But that's been a recurring theme as well in terms of getting our county back to some semblance of normality, is to be able to have church services again. Of course, with some social distancing allowances built into the services. So in summary, I'm okay with the suggestions you made for the deletions, and I recommend that addition.
Questions, comments?
Just a couple comments. One is I had a conversation with Mayor Keene from Lodi yesterday, and he was mentioning this conversation with other mayors in the county in regards to actually a city letter to the governor. I don't know whether that transferred to the conversation with your city attorney or whatever, but he was working with the mayors on that particular aspect. As far as the city of Escalon, they felt, because of their location, their remoteness, that maybe there were some different considerations that may be implemented in regards to, more flexibility from the county because size of their city and the number of cases and those types of things. So all I'm saying is there has been some discussion, at least based upon Escalon's meeting last night. I think Lodi's meeting tonight. But I don't have a problem with this, although I know that certainly you and Dr. Park have worked very hard to get the governor or the governor's staff to consider some additional options in regards to reopening some of these businesses, and to some degree have been successful. This particular resolution doesn't take away from a continued effort by the county and county staff, and obviously the supervisors themselves, to continue trying to get the governor to understand that there's a difference between his view of the world and the state and our view, dealing with people at the lowest level or at the ground level. And I have a lot of concerns about the way he's approached this as far as, quote, essential or non-essential, because frankly, I'm sure you've all experienced this, but, I was in the city of Manteca on Saturday at the intersection of Yosemite and Main Street. It was gridlock for 3 blocks in every direction. I don't see people staying home. And then there are events in my district that gather probably 1,500 people at one time. So the question is, we talk about stay at home, but, people aren't staying home. And the question as far as the equity or the fairness in regards to opening businesses is, on the one hand, we have these meccas of activity that are probably frequented by possibly thousands of people on a daily basis: Costco, Home Depot, Target. I'm not picking on them. I think that's great. And so we have all this activity going through, and we talked, and Marcia had mentioned this John Hopkins, when talk about risk, low, medium, and high risk, based upon time of exposure, number, frequency of exposure, and mitigation. And when you look at things in regards to local businesses, small, mom and pop shops, whatever, who have been closed, and yet the items that they sell are being sold in Walmart and Target and places like that, and it's killing them. And yet, if you used something more than this essential, non-essential nonsense, and took a common sense approach, because just to take Costco, for example, and I'm not picking on them, I was there last week, but my point is if you look at the period of time of contact, it's very minute when you talk about people going through the line. As far as frequency, it's high. As far as mitigation, with their plastic shields and their masks and things, they're mitigating it. And yet when you look at a small store in Ripon or Escalon or even Lodi, they may have less than 100 customers an entire day. They can do social distancing. They can wear masks. They can do a whole bunch of things to mitigate. And yet they're closed and they're dying. And that's why we get all these emails from individuals, because they're going bankrupt and they may never reopen. And so I guess my question is, why are we doing all this generic classifications when some common sense approach, and let the businesses and certainly the county and Dr. Park or Marcia, as director, make some common sense decisions and work with the businesses on what would be effective as far as reopening. One, for the safety of the employees, and two, for the safety of their customers. There isn't a business around that would openly risk their customers or their employees, because all you need is one outbreak, one incident, one food poisoning, whatever it happens to be, and they're gone, especially in this environment. So my question is, it would seem to me that it's somewhere along the way we need to at least inform the governor or his staff that there are other options in regards to criteria for opening businesses, and not just essential and non-essential, and the 4 stages and all those things. So I guess that's my main concern. What's really ironic is there was only one business I ever frequented before this pandemic that did any kind of sanitation protection for the customers, was my barber shop. So what's this all about? They're the ones that made sure that their clippers and their scissors and all those other things. So my point is, I just think that somewhere along the way we need to have a little more common sense to businesses, and not make a generic, based upon their category, saying, no, you have to wait until we open everything, because businesses can't wait. And frankly, I think Businesses I know are open. Right now, as we speak, there are businesses open, and they're doing it out of desperation. And businesses shouldn't have to be in that position where either they open or they close forever. I'm not talking just about the business. We're talking about jobs. We're talking about customers. We're talking about our economy. We can go talk about a whole bunch of other things. So that's my concern. And my last point is, by not opening, we give nobody choices, although they're taking, their free choice of rebelling, basically. But when you at least allow businesses to open, those who are very concerned about their health and contamination and spread of this, they can make a choice to stay home or wear a mask or whatever they want. They can do that. But at least other people have the opportunity to do other things. And that's my challenge, I guess, to the governor is, how can we be more fair, open up our economy, allow businesses? And I don't think, frankly, you look at, remember Georgia? Remember the furor over Georgia opening and the tattoo parlors and the hairstylists and the barbers, whatever? Well, they went from 54 4 days before they opened. They're down to 28. And so what's that all about? And we talk about models and projections and going through the roof and everything and a resurgence in the fall and things like that. I'm looking at states that have opened, Florida, for example, and Georgia and Texas and places like that. I'll give you one statistic on Georgia. They have had 649 deaths, 1,649 deaths, okay? Their ratio is 4.27. Ours is 33.21. Our ratio is 4.06. We have a lower ratio, and we talk about incidents by million. Georgia's had 155, California's at 84. We're half they are, and the population of Georgia is less than 4 million. That's 1/10 of the population of California. And so my question is, why are we so restrictive? And I mentioned at the last meeting, do they think that Californians are maybe less intelligent than people in Georgia and places like that? I think we've done one heck of a job in this state in regards to flattening the curve. And my concern is that as we continue down this path, more and more people are going to rebel. They're going to lose, faith in government or trust or whatever. And so I have no problem with this resolution. We can send it up there, but I think we need to have a discussion in regards to how we would recommend or suggest or offer or whatever you want to use the term, that there's a better way to make decisions on businesses than just essential and non-essential, which I think isn't working in reality. So anyway, that's my point. So thank you.
I would say that in response, I think that those conversations are occurring in a number of forums. And there are a number of efforts being made by cities and counties throughout the state to try and persuade the governor that there are more ways to do this than just his, and that some of this decision making needs to devolve down to the counties and the cities to determine how best they can open up. Because as he has said a number of times, that just one size fits all doesn't work. Well, it doesn't work for his criteria either. We saw that with the one size fits all that came out 2 weeks ago and allowed 20-something of the counties with very, very low rates of COVID in them to open up, while withholding that from other counties who have higher incident rate but have done just as good efforts to flatten the curve. And so this resolution that's before you is just one more opportunity to communicate to the governor through an official manner that continued request to let that power come down to the local agencies, the cities and the counties, to make these decisions about how they are best served to restart their economies.
I agree with that. I think this board, our county staff, and certainly our residents are fully capable of being responsible if we do this with obviously the right protocols in place and safeguards, et cetera. I think we've shown we've done that, you know, when you compare it with other counties of like size throughout the state. So my point is, you're right. And I, like I say, this is just another vehicle to get that message up there. But I think we need to continue beating the drum, so to speak. When I have 88 wineries and I have 32 that have tasting rooms, and you can't, tell me that somebody can't have somebody and have a glass of wine, you know, and most of them, a lot of them are outdoors, or at least they're open air. So what's that all about? So again, I just am frustrated sometimes that when you're at 38,000 feet and you're looking at things, I understand what it's like in his position considering 40 million residents. On the other side of it, we're at a much lower level and we're seeing on a daily basis. And I think that, we need to, and other counties I know are communicating that message to him now.
Right. It's my understanding that, and I watched a good portion of the announcement yesterday, that's pretty much exactly what the governor said, was going to delegate the majority of this down to our public health officers. And he was very clear the metrics had changed. It was about all of the things that we had advocated for last week in the letter that we sent up to the governor, that it should be about hospitalizations. It should be about what kind of a job have you done with your capacity, with your healthcare system, with all of the metrics that have made sense in terms of, on a per capita basis, what are your numbers actually showing? And I think we'll hear in a little bit from Dr. Park in terms of that. But my only concern with this is I don't want to waste anyone's time. I have no problems with sending it, but I think we're taking out so much of it. I'm not quite sure exactly if we're resolving anything that hasn't already been accomplished at this point. I think we have advocated very strongly over the last few weeks, not only for our own county, but through CSAC and through our cities and our partners. So I don't have a problem with the making the changes to this. I'm just not sure it's actually necessary. But I'm happy to hear your thoughts on that. I never like to waste resources working on something that is basically not going to have any impact or improve anything. So I would like to hear maybe from our CAO. Do you think that this will be impactful with these proposed revisions? If so, I don't think any of us have an issue with continuing to have this conversation.
So, Madam Chair, board members, the letter our chair put her signature to last week, I believe assisted greatly, along with a number of other urban counties also sent letters. I know as a result of yesterday's changes that the governor proposed, our county is much closer to be having the ability to attest. And so seeing that, as long as this does not expose the county to not being able to move forward, I agree, Madam Chair. I would prefer staff not to have to take, because there's so much going on and things are moving so rapidly. And so I have a question for County Council. Do we see the value that this is going to assist us at even a greater speed if, say, we are able to attest, say this week, I'm doing a what if, public health will have the opportunity to speak, I know, later on today. Does this really bring any greater value to that? I don't think so, and that's where I'm landing. And so I don't want to respond and say, no, I'm not in support, but I'm just not seeing how this moves the needle even further than us just being able to attest and move deeper into phase 2.
Well, and that's kind of where I'm going, because it says right in here that all of this will be done under the direction and with the approval of public health officer. So if we can already do that, and these changes have already occurred, which are going to allow our public health officer to attest sooner. None of it can happen until she's able to attest anyways. And it's going to be under her directive. So we're all talking about it's more important to have protocols in place so that people are safe and businesses understand how they should be operating. I don't want to waste any time on this if it isn't really going to help us. If it will, that's different.
And I would just say in response that the resolution that's in front of you isn't limited to moving forward deeper into phase 2. It asks it throughout. It says, allow us to make those determinations about moving forward, and it isn't focused just on move forward more quickly into phase 2, but across the economy. And I think that there is a benefit to it because at least through this document, you will have, the county and 6 of the 7 cities who are speaking together, who are speaking together to the governor to say, we have all put forth the effort at all levels, and most importantly, our citizens, to flatten the curve here. And at the state level, you should respect the efforts that we have made at all of these levels and the sacrifices that have been made at all of these levels, and allow us to adopt the appropriate guidance to reopen our economy.
Excellent. So do you need just direction from us, or do you need an actual motion, since this is going to be revised anyways?
If I can get a motion to accept the revisions, I will revise the document today, and I'll get it out to the cities.
All right, and then I will entertain a motion and a second.
I move to approve with the suggested adjustments.
Okay, thank you. Let's take a second, and then we have one other additional bit of discussion. Do we have a second on that?
I'll second the motion.
Okay, so we have a motion and a second. We have some additional discussion. Supervisor Patty has a question.
Thank you, Madam Chair. I'll just reiterate and thank you, County Council. I know it was last week we had talked about what Placer was doing. I think you took a more holistic approach, and I think it's fantastic. We have 6 of the 7 cities, and also it might be beneficial to reach out to some adjoining counties, so we maybe have a regional push. And this doesn't circumvent the efforts, of course. I think this is consistent with Dr. Park and what we need, but it really moves us forward, not waiting for the governor's timeline of whatever that might be for phase 2 and how deep we get into phase 2, and then when is phase 3. This kind of really is an argument and a presentation request for us to get into phase 3 and 4 at our own behest. And carefully and constructually. I also would like to add, and I'm not sure if we would do as part of the same motion, but I had a conversation with County Council, and some other counties have looked at the lack of enforcement and the ability to enforce. So I don't know if we want to take, County Council, would you suggest that we take a vote on this, or should we include maybe that as an addendum to this resolution if we were to talk about through the CAO's office the funding of enforcement, which is rather difficult at the county level, and I think we have a representative from the sheriff's office that could speak on that point. So should we do it separate, discussion point, or add it to this?
I think they should be a separate point, Supervisor.
Separate, okay. So Madam Chair, then we'll go forward, but I'd like to follow up with this after we take a vote.
Okay, fine. And again, I'm just going to say that I'm comfortable because the language is in there that this is going to come under the approval of our public health officer. The protocols are going to be under her directives. I want to reassure the public this is not just about flipping a switch and opening everything up. This is about being responsible to our local metrics, and this will be done under the direction of our public health officer, our medical officer, and our public health department. So we have a motion and a second. Ms. Voorhees?
Yes, I just want to mention that the Central Valley counties have been working on a letter for a couple of weeks, but with the changes the governor announced yesterday, we're having a call later today to sort of reassess, revise the letter. So we are working on a 8 Valley county letter.
Great.
Great, thank you. Okay, please cast your votes. That is approved 5-0. Thank you. Supervisor Patty, do you want to ask your question now of County Council in terms of
yes,
we need a companion resolution in terms of enforcement?
Yes, thank you, Madam Chair. I know that some of the other counties have done something similar, and County Council and I had spoke about it, and I believe County Council maybe present with us a couple of options as it comes to the enforcement code. And again, from the Sheriff's Department, we've had to empty out our jails with, some violent and some felons going back on the street, and a lot of resources from the Sheriff's Office have been dedicated to law enforcement from some of those individuals that have been out in the public causing more criminal activity. So I think as a county, we're really struggling to pay for all of the challenges that we have, and I believe that we may want to follow what some of the other counties have done and perhaps not dedicate resources to enforcement while we also have resources for law enforcement against criminal activity. So I know, again, County Council had it, and maybe somebody from the Sheriff's Office would like to give us a perspective of what we're dealing with at the county level once we've had all these jails emptied out from many criminals, not entirely, but many criminals that were incarcerated.
Good afternoon, Madam Chair and Board. I'm Dustin Cooling, the patrol captain at the Sheriff's Office. So I had our jail give me some numbers from 5 weeks going back from Friday morning. And in that time period, we've released about 437 inmates relating to the COVID virus. In that time period also, we've rearrested about 33. And those numbers, again, are from Friday. So it's a percentage of them that have been released we've had some contact with. Also, since the stay-at-home order was implemented in, I think it was March 20th, 21st, received about 473 calls for service regarding from the public regarding violations of that order. And we've responded to every one of them. Maybe not all of them in person, but we have responded in some way to every one of them. And it's cost us about 21 minutes per call. And that's cost us about a person for about a month. Deputy Sheriff, if you were to look at how much time they're spending on those calls. So it is something that we're dealing with. Additionally, I spoke with the Undersheriff of Stanislaus County yesterday. And as you know, they've rescinded their order locally. And the reason I called him was to discuss the implications of that as it relates to whether or not they're getting calls for service regarding order violations and how they're actually dealing with that. And in the conversation I had, it hadn't moved the needle whatsoever. They hadn't received the calls. They were referring them to state agencies. So the most of our calls of that 473 that we received came initially, right when the order came out. They've tapered down significantly. So I think people are just kind of getting used to the way things are maybe, or they're less interested, but we're not receiving nearly the amount of calls we had for the violations.
Right. But there is some increased activity with some of those felons that you've released. Almost 8 or 10% are out. There's some additional criminal activity to the public.
It takes some time to, so we rearrested 33 of the 437 that were released. That certainly takes time. That's not included in the calculus when we're talking about that one officer for a month. That's separate from the order violations, just dealing with
Right.
It takes time to arrest, to investigate, to book them in the jail. And
in general, the Sheriff's Department wants to increase neighborhood patrols and public safety at a time when there's perhaps more risk out there. So when it comes to dedicating funds and resources, perhaps dedicating time and resources to public safety is better than running around knocking on doors and seeing if people are doing dog grooming or if they're following the stay-at-home orders. So I would suggest that as other counties are doing, that we're really focusing on what's the best use of our funds as it relates to that time and the money that we have available.
So just yesterday, sir, I had our crime analysis group run a report to tell me the trend for calls for service. Have they increased? Have they gone down? And when you look at year to date from last year to this year, our calls for service have increased by 10.8%. So not only are we dealing with the COVID-related issues and the enforcement of that and the education, that's been our stance on it, but we now have all these other calls that we're dealing with too at the same time.
Excellent. Thank you. I appreciate the briefing. So, again, County Council, there's a couple of options I think you and I discussed and we looked at. Would you have a recommendation for the board to consider as it relates to, the funding and dedicating resources from the county for enforcement of the stay-at-home?
So, thank you, Supervisor. So I looked at specifically what occurred down in Stanislaus County. And what was adopted was a direction to the county executive officer not to use county resources to enforce the governor's stay-at-home order except for mass gatherings. And it's important to clarify that under state law and as it's been interpreted by the court, a directive such as this is not applicable to either the sheriff or the district attorney because it invades their discretion to execute their statutory duties. So while it may be appropriate if the board so directs to direct the county administrator not to expend funds to enforce the governor's order, that has limited applicability in that would address potentially the ability for code enforcement, or to use code enforcement to respond to enforcement efforts. It would have some impact on my ability as county council to initiate lawsuits or restraining orders against businesses that were violations. But in that instance, I would have to come to the board anyhow in the first instance to receive that authority to pursue that restraining order. If the board wishes to pursue this, I think that it's also important to clarify that it doesn't limit my office's ability to respond to lawsuits that are filed against us. For instance, we have two existing lawsuits that are violations of the county's and the state's orders, and we need to be able to provide a vigorous defense to the county or for the county in those lawsuits. So I would ask that if you do give direction to the county administrator not to use county resources to enforce the governor's stay-at-home orders, I think it's important to include the exception for mass gatherings and also to make clear that that doesn't limit county council's ability to vigorously defend lawsuits that are brought against the county.
Why was there a mass gatherings element to that?
Why mass gatherings?
And what constitutes a mass gathering, would you say?
There wasn't any documentation that was provided to the Stanislaus Board of Supervisors. That came up generically in their discussions. Mm-hmm. And I don't know if there was a definition that was provided for mass gatherings. I know that earlier in some of the early orders that were published, some of the guidelines that were published, at first they talked about 50 people, gatherings of 50 people. And that was reduced down to gatherings of 10 people. I think that that's a good point. If the order is going to have an exception for mass gatherings, I think it's appropriate to include what that limitation is. Presently, the county's orders allow for outdoor activities for golf as foursomes. We've kind of used that as a yardstick to measure other activities, but gatherings of non-family members and larger than that, I think would be a violation of the governor's order.
So my only concern in that regard is that, well, for there's the talk about church services at some point being considered religious services. You go to Costco and they're no longer counting people that are going in the door. So you walk into Costco, there's going to be 200, 300, 400 people inside of a Costco easily any given time. And I know, for instance, we've got a request for an outdoor ceremony, 120 people spread out across 100 yards of a football field. So that's, you're great in the great wide outdoors, and it's 100 people on a football field, and there's nobody even close to each other as far as the 6 foot distancing and clean open air versus being indoors where we know is a greater risk with repetitive exposure that somebody might be asymptomatic. So I'm a little bit, it seems a little random and undefined to say mass gatherings, maybe concentrated gatherings without social distancing. Could we include?
Sure.
Okay. So I would suggest that this board consider that
variance to stage 2, as you've all alluded to already during the course of this discussion today. Just to give a brief history, on May 7th, the governor offered to counties a local variance opportunity, which was an attestation process through which counties could self-attest that they met certain readiness criteria to move through stage 2 of the governor's roadmap at an accelerated rate compared to the rest of the state. After those criteria were released on May 7th, many counties were able to attest and move forward. However, we were one of the counties that did not meet the metrics. And along with many other counties, there was pushback on the metrics. And as we said earlier, this board did send a letter to the governor, as did many other counties. And I believe that he heard us loud and clear, and he reintroduced or introduced new variance measures just yesterday. So this is the variance to stage 2 2.0 criteria now that has been onboarded to allow this accelerated rate to medium and larger size counties with some relaxed metrics. This just appeared on the CDPH website yesterday, so as Supervisor Elliott said, I'm sure other counties are working furiously to fill out their attestations, and there will probably be some counties that attest this week, early this week. So the major criteria that was changed was this epidemiologic stability. As you may recall, the prior attestation criteria included that we had to have 1 per 10,000 count confirmed cases over a 14-day period, which meant that for a county of 762,000 people, we had to demonstrate that we had 76 confirmed COVID cases or less in a 14-day period. That has been changed to 25 per 100,000, which for our county allows us to have 190 COVID positive cases in a 14-day period, and we clearly meet that new criteria. We currently have a 126 positive COVID case number count for the last 14 days, counting back from today. The criteria that said that a county could have no deaths in a 14-day period was really a hard one for us to meet, as we were still experiencing deaths. They have now removed that and put in some different criteria. There is another epidemiologic stability criteria that says that a county has to have a less than 5% change in hospitalization rates over a 7-day average, or no more than 20 total confirmed COVID-19 patients hospitalized on any single day over the past 14 days. We have not surpassed a daily hospital count of 20 people in our 7 area hospitals over the past 14 days. There were 19 in hospital yesterday, 18 now, so we are meeting this measure. So as far as the epidemiologic stability measures, there were 2 sections, and each section has 2 components, and it's an or, so you could have one thing or another, and then there's the second section, one thing or another. So out of the 2 components, we are meeting the measures. The other measures were protection of stage 1 essential workers. We had to demonstrate that we have guidance for employers in essential critical infrastructure workplaces. This was something that we felt we had already met as of the first variance, because we do have social distancing protocols in place in our county order. We have, at San Joaquin County Public Health, developed guidance for employers, as well as a reporting method for employers to report outbreaks. We have a social distancing protocol attached to our order and a symptom checklist. Testing capacity was unchanged. There was a requirement to test 1.5 people per 1,000 residents, and we had met that requirement already as of last week. And then the testing availability for at least 75 residents to be able to drive to a test collection site within 30 minutes in an urban area and 60 minutes in a rural area has been met. The state is now asking for us to give a statement on your own county's testing volume, and if it doesn't meet the testing capacity, what is your plan to meet that capacity? As far as containment capacity, we needed to demonstrate that we had the contact tracers available at a rate of 15 per 100,000. Our HR staff is working very hard to onboard these people. And as we said before, we do have the contact tracers. We are open to receiving more. If you look at our homepage on the San Joaquin County Public Health Services website, at the bottom of the homepage there is an email address that people can use if they're interested in volunteering, because we are interested in keeping up this number to the required number. And as some of these students may be in and out of their summer break and maybe volunteering for a week or two at a time and not for the entire rest of the summer, we would like to gain access to more volunteers. There's also a email address that has just been set up as of yesterday for people who want to volunteer. It's volunteer@sjcphs.org. Another thing under containment capacity was the fact that we had to have 15% of our homeless population able to be housed. Our homeless task force has been working very hard on this number, and I was able to communicate with some of the folks who are doing that work. And we are able to attest that we have Project Room Key rooms and that we have the capacity to use temporary scattered site motel rooms as needed for COVID positives, and that we've gained permission from the state to use the Sleep Train Arena for any surplus. So we believe we have met that measure. Hospital capacity at 35% minimum surge. We have that. We had to have a robust plan for the protection of hospital workers with PPE attested to by all of our hospitals. And yes, as of yesterday, we have now received letters from Doctors Hospital Manteca, San Joaquin General Hospital, St. Joseph's Medical Center, Sutter Tracy, Adventist Health, Lodi Memorial, Dameron, and Kaiser. So yesterday, we did receive all 7, or we were we were able to say that we had all 7 hospitals. And the same hospitals, as part of their attestation that they have robust plans, have also written in their letters that they are supportive of this attestation process, which is another requirement that we needed. Another major difference that was added in addition to the metrics to this plan was new language about vulnerable populations and skilled nursing facilities. Not only do we have to demonstrate that our skilled nursing facilities have a 14-day supply of PPE on hand with the ability to procure more from non-state supply chains, they have added that we need to be able to describe a plan that we have to prevent and mitigate COVID-19 infections, including our plan to engage with each skilled nursing facility on a weekly basis, share best practices, and address urgent matters. Fortunately, as I have said to this board before, Public Health has already created a long-term care team. Since the middle of March, we have been engaging with our skilled nursing facilities, and we do already, with our nurses, have weekly check-ins with each of the skilled nursing facilities in the county. And we have helped a few of them through outbreaks, and we're helping a couple right now through outbreaks, but there are 25 in all. And we have been able to demonstrate by calling all of them and making sure that they have PPE. They are all attesting to the fact that they have the PPE that they need and that they have private sources for continued chains. The rest of this is just a lot of additional writing that is required on our sectors and our timelines, detailing our our county's plan to move through stage 2, what that would entail, what types of triggers we would use to adjust these modifications and possibly tighten back our modifications, and then a lot of writing about a containment plan that would be required. We had a health officer call with the state a couple of days ago in which we were told that once you attest, there will be ongoing measures, so we're not done measuring ourselves. So basically they're giving a lot of work to all local health jurisdictions. The message is that once you attest, you're not done. You're going to be responsible for following these numbers on a periodic basis. So there's a separate containment plan that they're going to be introducing to us, but it hasn't been finalized, so I haven't seen that document yet. There is a 5 o'clock telephone call today to discuss these new variance measures for any counties that have questions, because they know that counties are now working to get in these criteria and to get their metrics in. And for anybody that has questions, there is another call today to address that since this just came out yesterday. In addition to talking about variance measures, what's also on the agenda is hair salons. So, as is very common with the state, they ask for county public health officers to give their input on what we believe the guidance should be for hair salons. And so they're going to be asking for our guidance today because it seems to me that they must be in the process of creating industry guidance. What this variance through stage 2 accomplishes for us is getting us through the rest of stage 2 at a faster rate than the governor might open for the rest of the state. And the two big ticket items that are remaining in stage 2 are basically dine-in at restaurants. So this would include outdoor and indoor dining and destination retail. So this would include shopping malls and swap meets. The state has already released industry guidance for both of those things. So I would ask that restaurants and shopping malls in our county start to look at the guidance on the governor's covid19.ca.gov website. For the restaurants, there is a 12-page guidance, and for the shopping malls, there is an 8-page guidance on retail. So I can't possibly go through all the measures with you, but we will be asking for them to follow the statewide guidance that has been issued, which includes marking 6 feet, sanitizers, checking for symptoms, having your employees report that they're symptom-free before coming to work. Much guidance on that. So, I believe that we are prepared to attest this week. I have some work to do on this. As far as writing it up, it's just a matter of maybe crossing our T's and dotting our I's as I get some final numbers in and some final language from some of the partners I've been working with to help me through this. But I believe that in the next couple of days, we should be able to attest as a county. And what I'll need from this board is the board's acceptance of the paperwork once I've done it all.
Great, thank you. Dr. Park, I have one quick question. I thought one of the new metrics was that to encourage counties to ramp up their testing, that you needed to demonstrate that less than, I think it was 5% or something of the population that tests has to be less than 5% COVID positive. Is that not correct?
So there is a 5% on the epidemiologic stability. So under epidemiologic stability, there are 2 categories, and under each category, there are 2 choices.
Okay.
So one of the choices in the first category is that you make that 7-day average of a daily % change in total number of hospitalized confirmed COVID-19 patients to be less than 5%. According to my epidemiologist, we're just a tiny bit above that measure at 5.2% over the last 14 days. So we don't have that measure met, but the or part of that is the no more than 20 people hospitalized on any single day over 14 days. So for that first part of the epidemiologic stability, out of the 2, we do meet 1. And then the second part of epidemiologic stability is to have a 14-day cumulative COVID-19 positive incidence of less than 25 per 100,000, or testing positivity over the past 7 days of less than 8%. And that's an or, but I believe we meet both of those on that measure.
Okay. So the more people get tested, especially people who don't have symptoms and are healthy and are going to get negative results, the better we are on this metric, correct?
Yes.
Okay, so I highly encourage everyone to go get tested. I went last Friday. I signed up, my husband and I, on a Wednesday at the Verily site at San Joaquin General. We got tested Friday morning. I showed up 15 minutes early thinking there would be a line. There wasn't. We were back on I-5 in less than 10 minutes. That was Friday morning, and we received our test results yesterday afternoon. It was 100% free. It was about as easy as you could possibly make a process. And we were both negative, so I like to think we're helping to contribute to our good metric on that one. So I would really like to make sure that the public knows the testing is not just if you have symptoms, and it's not just if you're not feeling well. It's even more important if you're feeling well and you don't have symptoms to go get tested so that we can increase and maintain our metrics there. Let's see, we have a couple of, Supervisor Elliott?
That's still a carryover from last time, but I'll say something anyway. All right, great. Well, I just want to say great work here, Dr. Park. It looks like you've gotten the bases covered, and I hope you're getting lots of help in providing all of this data that needs to go into this attestation. And as I said before, I would really like to see it in today if we could, if you can get that done. But I think the quicker we get it in, the better off we are, because I think our best opportunity right now, rather than just focusing strictly on pushback, is to take advantage of the opportunities that we have to accomplish what we want to get accomplished, which is getting our business back open and our people back to work. So thanks for all you've done on that.
You're welcome, Supervisor Elliott. I will do my best.
We appreciate it, Dr. Park. Supervisor Patty?
Madam Chair, yes, very much appreciated. I know that's a continuous 24-hour day, 7-day week for you, I'm certain. So give me a little timeline here. Let's say we get the attestation done sometime later this week, and then we're able to be firmly in phase 2, allowing malls and limited seating at restaurants effective when? And then next question would be, what's it take to get to phase 3?
So Supervisor Patty, the way I see this and the way that I've seen other counties attest through that very first variance was that once their variance attestation was posted to the governor's website, that meant they got the green light to go ahead. And they were allowed to proceed as they wanted through the rest of stage 2. That is the plan that I still need to write up. It's not going to be a very complicated plan to write up, I will admit, because there's really only 2 things left that I know of, which is the dine-in restaurants and the shopping malls in stage 2. So if we're able to do this, get it signed off by Chair Miller, and submit it, I believe we're talking about having restaurants open for dine-in service this weekend, because we would have that as part of our plan. And as long as that was part of our plan and we gave the date Friday, Saturday, then once it was posted, that meant that the state had accepted your plan and you can move forward with the plan the way that you had outlined.
And you had mentioned something about is it that we don't have it ready yet, or something about the dine-in and the shopping malls, something wasn't ready? Is that from the state, or I'm a little confused there?
No, not that we're not ready. I don't know. I'm not really sure what I might have misspoken.
Issues twice. So I'm just wondering, once you submit, then we should be able to do dine-in and shopping malls.
Yes.
There's no extra anything that needs to be, that's into phase 2.
Exactly. So the way that some counties wrote it was they would say, like, for example, the counties that attested on May 7th, they might have said, we're going to do pet grooming on May 8th, car washes on May 9th, dine-in on May 10th, and they had plans. At this point, we're far along into stage 2 with what the governor has already opened, and so with those 2 things being left, my plan is to ask for both to reopen immediately once accepted. I don't think I'm going to tier out the difference between restaurants and shopping malls. It'll be, if you're accepting our plan and we can attest, we would like to open both of those entities immediately.
Okay, providing and they follow the guidelines as specified in the CA, what was it again? COVID-19 CA.gov?
Right. So it's COVID-19.ca.gov. There is restaurant. You look for industry guidance.
Okay.
And there's one for restaurants. And there's a separate one for retail, which includes the shopping malls. And I mention that now because I'm hopeful that we'll have this in by the end of the week and will be attested by the end of the week, and that those entities will be ready to go and that they'll do social distancing the way the guidelines have set out for them to do.
Do we have a press release to this effect that we can, because companies need to know to ramp up. They can't just all of a sudden open up the next day. If they need to prepare in advance, food, staff, you name it, they're going to have to prepare.
There should be a board press release today based on this, and perhaps it'll come out in the news. In addition to that, public health staff can do some additional advertising for this to make sure that people are readying themselves.
And what's our timeline for phase 3?
So one of the things that they made very clear to add in this new stage 2 variance is a sentence that says this does not allow you to move to stage 3. So they made it very clear that we're only attesting to move through stage 2 faster. And there is no timeline specifically that I know of for stage 3, except for what the public knows, and that was that Governor Newsom himself is talking about weeks. When he did his press conference, he said that he understands people want hair and nail salons and they want to have their churches open, and he asked for patience, and he said that it would be a few weeks. So I don't know what that means to the governor. We haven't received any specific date on that.
So hair and nail salons are phase 3, not phase 2 in any capacity?
Yes.
Okay. And what about outdoor sport activities? We've got, kids' youth programs. We've got, cars that want to drive around tracks. There's plenty of social distancing in between drivers. I don't foresee any reason why we shouldn't allow that.
So there's been no specific guidance given on that, and I'm sure the governor is working on it. This is something that the health officers pleaded with them for, because so many local organizations are asking us, can we do Little League? Can we open up our pools? Can we do the racetracks? In addition to that, questions about summer day camps. Are we part of child care or are we not? Because he did say child care for non-essential workers was allowed on May 12th. It's not clear whether that includes other things, such as summer camps. And without the clarity, I cannot say with any definitive answer that we would have a date for that. So we're still waiting on the state to get back to us with some more clarity on those very specific measures. But sports is one of them, and summer camps is another one.
So the challenge I would have for us is we've got motor raceways that are already functioning up and down the state, and they're not in phase 3. So I would think that we should be able to, if they're doing it there, I would think we've got the ability to do it here. Again, we're not bringing in 5,000 people. We're not bringing in 500 people. We're bringing in, a couple dozen racers and a few spectators that are family.
Mm-hmm. And there are some things like that that are unique situations where there's no clear yes or no. There's no such thing as motor raceways in stage 2 or stage 3. So it's very hard to know which stage does it belong in when the governor's roadmap doesn't have a list of every single type of business out there. So with things like that, what Director Cunningham and I have been doing is we have been forwarding emails like that to the state for clarity to see if they can interpret the law for us, what they believe is in stage 2 or stage 3. And I believe on a couple of particular emails about raceways, those were forwarded to the state.
Okay. And just in closing, I know that at some point, we had challenging discussions, but we also stepped up as a county and allowed golf. And so this might be one of those instances where, whereas we've talked about, do we want to go and enforce somebody riding around a racetrack that there's plenty of social distancing? And so I do not think we should spend resources going and pursuing and chasing after something like as simple as a swim lesson or somebody at a sporting event with, but a dozen people watching. So, finish with that, but thank you.
Mm-hmm. Thank you. Are there any other board members? Supervisor Wynn?
When you say hair salons, I assume that includes barbershops. Is that correct?
Mm-hmm.
Okay. All right.
Does not include nail.
Okay. Got it. Mm-hmm. I raised the issue earlier in regards to what Stanislaus County did in their public health officer, and I didn't want to put you on the spot or speak for you, but what are your thoughts in regards to San Joaquin County basically saying that we defer to the governor's public health order as opposed to a county health order, which I suspect to some extent would take some of the pressure off you because it's not you, disseminating this for the public. It's basically saying the governor's or the state health order is supersedes anything that we would do here.
And thank you for bringing that up, Supervisor Wynn. And in regards to what Supervisor Patty alluded to earlier with the golf courses, I want to make it very clear that I have not moved forward ahead of the governor in any instance that I'm aware of. I did open up golfing, but only after he gave the signal that golf had been okay in other counties. So I've been very careful to follow the law and to follow what the state is telling us. So in that regard, I will tell you now I have no intention of moving outside of what the governor is doing. from here on forward. So I have entertained the idea of rescinding my order because I don't really think it's going to make much difference from here on out when all we're doing is finding out from the governor what he's opening and then adding it to our local order. In the beginning, it was useful to have a local county order because there were some things that did require some clarity, and there were some things that as a county we were able to provide more local direction for. But at this point, it's very clear to me that the governor is dictating the moves. He has created this roadmap. He has been disapproving of other counties that have tried to move ahead of him, and to the point of threatening their funds. And these counties have been called defiant counties, and I don't want to really be thrown into that mix at all. My intention has always been to wait for the governor's signal or the state health officer's signal and then move forward from there. So yes, I have considered rescinding the order. To be very honest with you, I did have somewhat of a clue that we might be talking about the law enforcement issue today. And my feeling was that if we were to say that we were no longer going to have law enforcement enforce our county and state rules, and then I was also to rescind my order on the same day, it would kind of send a confusing message to the public that we're not enforcing and there is no county order, and I didn't want to confuse the public into thinking that there's total anarchy and nobody regulating any of this at this point. As you can hear from the letters that are read in the public comments, there are still many people out there who think we're moving too fast. So there's still people on both sides of this, and there are still people who are sick in our hospitals, and I have to weigh all of that risk with the balance of the fact that we do need to open up our economy, which is very difficult. So this is something that's still on my mind and in the works, and something that I may be doing in the future. In the next week or two, I might be rescinding my order. As time goes, and I watch the governor, and I watch what other counties do with their variants, if I see that there's no real usefulness in having our own county order because there's no wiggle room to be any different from the governor, then I don't see the usefulness of it. It's actually quite burdensome because as you all are receiving letters, so am I, and I just want to get back to the work of public health, and all I'm doing is spending hours and hours answering emails as to what's legal and what's not, and what can open and what cannot. And really, if we defer to the governor and fall back to the governor's laws, these are all questions that the public can be asking the governor, as was previously said.
I guess from what you're saying, it appears that what we're doing is redundant to what the governor's doing. And the second part of that is it doesn't relieve or negate your responsibility as a public health officer, because you still implement the openings and provide guidance, certainly for businesses that may have a question as far as San Joaquin County. But at least a lot of and obviously the vast majority of emails and calls and contacts I have is believing that somehow this board or you as the county public health officer has the authority to open it, and that's not true. And so I guess if nothing else, and it was mentioned earlier about staff time, wasting staff time when there's no benefit to it, or the other part of it in regards to why are we doing these if there's really no purpose or value in performing it. So again, I'll leave it up to you. Obviously, that's a decision you have to make, but I would say that it may provide some clarity to the public as opposed to focusing on you and your health order. And I'm not suggesting that we kick it up to the governor, but frankly, that's the only place that can make the change. And I would also suspect that even if you did that you would still advocate, as our county council Mark Miles has done, his staff, and our CEO, you would still advocate to the governor or the governor's staff on things that come to your attention that need some modification. So that wouldn't change at all with the rescission of the health order, correct?
Exactly. I I feel that at this point, our order as a county aligns very well with the governor's order. Everything that we've done is something that he has pretty much already blessed. And so there's not a significant difference and not much to gain, but I do know that the public will still be seeking clarity from us when the governor's not clear. So I think that Mr. Miles will still be quite busy answering questions from the public with his, seeking his expertise in interpreting the law. And I want to publicly apologize to the hundreds of people who have sent me letters. I just can't get back to every single one of them. And I know people feel upset and hurt when I don't get back to them, but the truth is it's just I'm inundated with that responsibility, and I would like to get back to the work of dealing with the public's health. So I want to make one comment on the law enforcement side, and that is to say that from my point of view, the law enforcement people in this county, the entities and the organizations, including the sheriffs and the local police departments, have always been more of an educational entity than an enforcement entity, and I thank them for that. I believe that law enforcement has been so integral with spreading public health's message, and I really do believe that here they've been doing a lot of educating for us. At the same time, although maybe we're not doing any harsh enforcement, the fact that they are still around and still willing to enforce our laws does help with the public's perception that there is something around for safety measures when there are people, such as Chair Miller said, who might want to disobey in a very flagrant way.
I would add to that, I have a tremendous amount of respect and trust in our law enforcement community, especially our sheriff's department. And I found by experience, and most of you are probably too young to remember this, but in 1974 when they lowered the speed limit from 70 and 65 to 55 because of the gas crisis, officers out there on the road did not change their criteria in regards to citing people. In other words, what I'm saying is I have a tremendous amount of faith in our sheriff's deputies and our police officers to do the right thing, and I think they use good judgment. And that's why we still hire humans as opposed to having robots.
Yes. I believe that our sheriff's department and our local police departments have taken a very measured approach to this whole thing, and I think that they've done a phenomenal job. So, again, I'm just thankful for that, that I have their backing. So,
thank you. We appreciate it. County Council?
So one of the things that would be appropriate, given the timeline that Dr. Park has spoken of with preparing the attestation by the end of this week, is for the board to take action to authorize the chair to sign a letter of support when Dr. Park's attestation is available for review.
I move that we give that authority now.
Second it. Sooner the better.
Okay, we have a motion and a second to move forward with the attestation and sign whatever board letter is required to go along with that when it becomes available. Cast your votes. That is approved, 5-0.
Thank you, and I forgot to mention that I'm thankful for Supervisor Villapudua. We've received a lot of support from him at Public Health, and that includes the procurement of some facial cloth coverings for our many student volunteers who will be doing contact tracing for us. So I want to thank you for that.
Supervisor Patty contributed also.
Thank you, Supervisor Patty.
Supervisor Villapudua sewed them. He has a sewing machine at home, so he was busy working. He's very, very domestic.
Great, thank you. Next up, we're going to get a brief overview by Greg Diederich on contact tracing. Kind of exciting.
Thank you, Madam Chair. Manual contact tracing is very labor intensive. It's not always effective in identifying all potential contacts, and at the scale that is being mandated by the state in regards to the variance attestation could be very expensive. If we're looking at 115 individuals, that could be on the order of $5 million per year, and I have concerns with how we are going to be funding that come 2021 after the CARES Act money is no longer available. How many of us really know where we've been over the past 14 days, those locations who we came into contact with, much less the names of those individuals that we came into contact with? We can potentially complement our manual contact tracing with a voluntary smartphone exposure notification application. And you might have heard back in March, Apple and Google, who are really historically kind of adversaries and competitors, have released an application programming interface that will allow individuals to create apps that will access their platforms and their technologies. Several states have already adopted such technologies, and I would comment that something similar was highly effective in South Korea at the beginning of this pandemic. These tools would use both Bluetooth and GPS data to look at proximity and duration of the contact with others. And I know GPS is something that they've started to expand into, and I think that really provides some validation to the end user. But if you think about GPS, it's not military grade on our phones. I'm further than 6 feet. GPS really wouldn't know about it. If you think about this building, we're in a vertical stack. There might be somebody that looks real close to me. But I need the GPS from some validation point, but it's really the Bluetooth technology and the different protocols can tell you how close you are, and it's using that proximity as a measure of how close, and it would know if I'm on the other side of a wall, less signal strength, and therefore not a potential exposure. Obviously, there's privacy and security concerns with this that really need to be addressed, but the data itself would be encrypted. It's not individually identifiable. It's not held onto by a government entity, and after a 30 days time frame, it would be wiped away. Let's all be honest, big data has all of our location anywhere. No matter what device we use, it knows our search history. There's other thousands of data points that big government, our big data already has on us. So this is actually a use for the public good. It would be a opt-in model, and the value really starts to present when larger majorities of a population actually would adopt this technology. And again, it's exposure notification, not tracking of individual users, and we would have no access to actual location data. So what would happen is if people were using this and an individual who's using the application became COVID positive, and we could confirm that, the system itself would basically look at all of their potential contacts based upon that Bluetooth data and then notify them almost in real time. And this allows us to get out in front of it quickly, but it also would tell them of a potential exposure and give them priority access to testing. This could, like I said, almost be immediate. It allows public health to address an outbreak early on and help stop community spread that could result otherwise. This could be part of our attestation. As Dr. Park mentioned, we're building the number of contact tracers that are required, but if we put this as part of our attestation, it could also demonstrate to the state that we have an increased ability and maybe allow us to open up other sectors of the economy a little more quickly. I participated in a conference call yesterday with Mayor Tubbs, City of Stockton, and Jerry Becker on the City of Stockton's willing to partner with us. I'm looking to get some feedback from this board on this potential to engage. It would be a nonprofit entity that is working with several other counties within California to implement this type of technology. Again, it's a nonprofit. They would not be monetizing this at all. There wouldn't be ads or selling of the information. It's actually free to counties to implement. The app is actually used, I think they have a 19% penetration rate in New York City and a 10% penetration rate in LA County. And as I mentioned, the more people that are using this, the greater value. So I just wanted to receive feedback from the board if healthcare services and public health should seek to engage with this nonprofit on this potential. Thank you.
Thank you. And there's no cost to this?
No, we asked a couple ways yesterday on the phone call. It's a startup company with that's a nonprofit. There is another arm to the company that actually has an enterprise app that has to do more with public safety and would be, hey, I'm in a location where, let's say, there's a police lockdown or something going on. It could push a notification. So it's part of a larger app. It's the specific contact tracing or exposure notification portion would be free to counties.
Wow, that sounds amazing. And it isn't going to be a situation where we get into it and then next year they start where we have to pay a licensing fee every year of, $480,000 after the money's gone. I mean, if it is, can we buy it up front and use our funding?
Yeah, like a little loss leader gets you hooked on it, then.
Exactly.
My understanding is they have a perpetual license to the nonprofit entity that would be performing this, where it's a perpetual license for this COVID contacting element of it.
Great. I hate to be so suspicious about things, but I've been burned. Supervisor Wynn?
Well, I wasn't up, but I do have a question. So
It's just popping up out of nowhere on my screen.
I replaced Bob. So as I understand this, then if I have this app on my phone and you have the app on your phone and Supervisor Miller has the app on her phone, if we were close together at some particular time, it would be able to replicate our meeting or our group together of who was there?
Correct. So all the individuals that have the app, that's how it knows. It basically uses a token on your Bluetooth that's going to be randomly changed, so I can't identify you. But basically, when heaven forbid Supervisor Wynn becomes positive, it would basically look back through the 14 days of history. Who did you physically come in contact with as far as a duration and a proximity, and based on those metrics would then push out an alert to those other users that were potentially exposed, alerting them to that fact. And there's some other items with the app that would look for signs and symptoms. It is something that we could potentially integrate into our manual process. But yeah, as you just mentioned, it would then notify the others of a potential exposure.
So
pretty amazing.
I can, well, it's pretty amazing. It's pretty scary too, because.
Yeah, but like I said, we will not hold the data. I don't have access to the data. I can't go in there and say, oh, I see my neighbor is enrolled. I want to go see everywhere they went in the last 2 weeks. I have no access to the data at all. As well as I mentioned, it is basically de-identified. It would only provide an alert to public health if indeed there was an exposure and that we confirm that the person was positive.
Well, I appreciate that, but I've had several conversations with Mr. Becker in his previous life, and I will tell you this, you may not have access, but I would venture to say Gina would have access and a whole bunch of other people. So that's my concern. It's not you, it's those, and let's face it, I don't know, maybe I'm overly paranoid. There is nothing that you can protect anymore, and you just look at the hacking that's occurred worldwide. Nothing's safe. So again, but I appreciate that. Thank you.
Supervisor Patty?
Thank you, Madam Chair. Shocking, I have a question. So I have a question for you. You mentioned something about a $5 million annual cost for, is that for the training, that's employing, that's reaching a matrix, that's worst case scenario? Give me a little more info, please.
I'd say that was a worst case scenario. So if we were mandated to have 115 that were not just trained, but were actually in a chair and doing this, obviously some would be public health staff, county staff, paid staff, or volunteer staff. But I just look at 115,000, or probably 115 individuals at $40,000 per year on average. That gets us into the $5 million range.
Can't imagine with so few numbers that we have here in San Joaquin County that we're going to need that type of full-time employee. And I understand this worst case scenario. So my suggestion might be, and I know this is what the governor said, because there was a downloadable or a program you can go online and be certified as a contact tracer. So question would be, volunteer groups. We might get something, as you mentioned, there's already one, but then we also have departments where let's say some staff of the HSA department, they've got hundreds of employees there, might be able to dedicate some time during the course of a day. So they're already employees. If there's an extra incentive for them to be part of this extra new enhanced workforce, that might behoove us, but it's not a full-time employee with a full-time pay. It might just be an extra 500 people or 1,000 people we already have currently working for the county that have now gotten a little extra certification and they perform services, and it doesn't cost us nearly that amount.
And this would be supplemental. It would be an add-on to our manual contact tracing. And indeed, we might need to have 115 certified and trained, but unless we actually have contacts to trace, they would not be doing that as their day job, if you will. But as I mentioned, I have a calendar. I know kind of where I go, but I couldn't tell you where I was the last 2 weeks, what time of day, who I might have came into contact with. And like I said, it's very labor intensive to do the contact tracing, especially at this scale, and then to contact all these other individuals. This would supplement the manual process, and as I mentioned, would be almost immediate. It wouldn't be, hey, I have a COVID positive. The next day I come in, it's on my work list, and I start working that. It would have been almost immediate that these individuals could have been contacted.
Okay, thank you.
From my standpoint, as long as this is an opt-in, only people that are comfortable with this would opt in and participate, and it's a supplement to our more traditional track and tracing. For one, I think it's a good way to bolster our ability to meet those attestations and the ability to notify the public if something does pop up.
It most assuredly is opt-in. Individuals can opt out at any time. Individuals could turn off the Bluetooth or turn off the GPS item in the app at any point in time as well.
Now, I've seen enough spy movies to know that even when your phone is turned off, Mr. Diedrich, they can find you anywhere in the world.
That's why you can't remove your batteries from your phones anymore.
Exactly. Okay, is there anything else from the rest of the board? Do you need just direction from us to go ahead and move forward with this, or?
It would just be some engagement with the mayor's office, City of Stockton, and the entity. We would not move forward until we actually came back for further guidance. It's just more, can I go down this route to explore this potential?
Oh, okay. All right. You do want to speak? Okay.
Yes, thank you. So on that requirement for 15 per 100,000 contact tracers, I keep hearing Dr. Galley from Health and Human Services, the California Health Human Services Agency, I guess, keep saying that at the state level they are training people, and I think the last count was that they had 500 people that were ready to go to supplement county needs for contact tracers. So I think unless I can't imagine that we would need to have 115 people all the time to be doing that. So why don't we just have an on-call as needed request in there that when we need supplementation of whatever number we decide we're going to need on a regular basis, to ask for that assistance from the state.
And we have put in a mutual aid request for those state-based contact tracers. And as you mentioned, Dr. Galley, the requirement is that we have up to 115 trained and available. And we're working through that. Obviously, we have communicable disease investigators within public health that are trained. We had individuals go through the first cohort of training from UC San Francisco. We have individuals that were signed up and started training yesterday. So we are working, and this is all information we write into our attestation plan of how we are meeting that metric and how we plan to meet that, even though we don't have let's say 115 right today. The mutual aid request that we put into the state will help support the 115 that we will be required to have. So we did put in that mutual aid request.
Good. Thanks.
Great. Okay. Thank you. Thank you very much. Next up, and our final presenter is Jerry Becker.
Good afternoon, Madam Chair, members of the board. Jerry Becker, Assistant County Administrator. I know the board has had a long day, so I will be quick. In late March of this year, county departments began closing their facilities to the public in order to comply with COVID-19 related stay-at-home orders and to implement necessary protections for our employees and the public. On March 31st, the board passed a resolution approving staff's recommendation to close the facilities, again, for the protection of the public and our employees. Since that time, county departments have been hard at work developing and implementing appropriate safeguards to effectively reinstitute direct contact and service delivery to the public. We are pleased to announce that the necessary safeguards are now in place in many departments, and beginning on May 11th, last week, county departments started to reopen their facilities to the public for in-person service delivery. So today, Madam Chair and members of the board, staff is requesting that the board pass a resolution approving and authorizing two actions. First, approve the reopening of county departments that have been closed to the public due to the COVID-19 pandemic, including those departments that have already reopened for in-person service delivery. And secondly, delegate authority to the county administrator to approve the reopening of any county facility that is currently closed to the public once the necessary safety measures are in place at that facility. So, Madam Chair and members of the board, that concludes my brief presentation. Staff recommends that the board approve the proposed resolution. Ms. Nino and I are available to answer any questions the board may have on this matter.
Any questions? Nobody's popping up on my screen, so I'm going to need a hand flag if you... I don't think so. Then we would be... I have one quick question. So as we reopen our departments, I know that a lot of them we gave more flexibility to our department heads in terms of how they deployed their staff, both initially in the pacing of who they sent home, how they got them ready to work remotely, that sort of thing, or schedule them so that they could maintain social distancing. Does that flexibility remain for our department heads in terms of bringing folks back?
So, Madam Chair, so yes, much of the flexibility remains. We are still encouraging department heads to look to adjusted schedules to provide social distancing. We have encouraged departments to look at structural changes, plexiglass at locations. We've encouraged them to look at, where necessary, rearranging office space so that there's a permanent amount of social distancing, markings on floors for people in line, managing their lobbies to make sure we don't have too many folks in the lobby at one time. And telecommuting remains an option. However, we have told the departments we would like to see them limit that to 2 days a week so that we can start to get our employees back to the office. I would mention to the board in one of my previous presentations, or more accurately, the presentation that Ms. Nino and I did, there are a number of our employees who are running low on their balances. And so one of our underlying tenets is that we want to be able to make sure that our employees can have income and health care and things of that nature. So the sooner we can get them back to a safe environment, the more effectively we can, we hope, reassure them that their income will be solid and will be ongoing.
Great. Thank you. Okay, then I believe we're looking for a motion and a second to approve these recommendations.
Move to approve the resolution approving reopening of county departments closed to the public.
Second.
We have a motion and a second. Please cast your votes. That is approved 5-0.
Thank you very much.
Thank you very much. Okay, that is all we have for today. Ms. Nino, do you have any final words, or is there anyone else that the board needs to hear from? That's all I had on the schedule. Oh, Ms. Cunningham, come on down.
Thank you. I too will be very quick here. So, Marcia Cunningham, you heard from Dr. Parkin how she's bombarded with inquiries. I think everyone sitting up here has been, myself and a number of many other people. Well, we started with some of those inquiries and letters coming forward to me, and then it expanded to everybody was sending everything to me, and to help Dr. Park have more time and her staff have more time, they also thought it was a good idea to send everything to me, which is okay, because through that we've gained some efficiencies. What I have found is a lot of those are duplications, and there was duplications in effort taking place. So what we would like to do is to streamline the process even more. And through our Joint Information Center, through the Office of Emergency Services, if they could go through to sjreadyfeedback.org, staff there, because, and we know how serious these are, and we want to be following through on them. What we are doing in some of the work that I had started to do is I was sending it to the state level as well as the CDHP to the state, so the California State Public Health Department, to get input from them. That will continue. They will be tracked, and they will be tracked by city, the sector, the type of industry, who we exactly got it from, and then weekly a report will go out to all of us with here's where it got sent to, we've replied to the individual, and then kind of the status of it. I too agree with the squeaky wheel goes a long way. In addition to not just us submitting them to the state, we are asking the individual businesses where it's a business to do that as well, because we think that's helpful. So I know yesterday Shelley sent out a message to everyone in that regards, but for the public, they can get to that link. It's on our website, the sjready.org website, in several places, top, bottom of all the pages. And we're just trying to streamline it, and make sure people are getting a response, and where we need to be pushing those up, that we are. That's it.
Great. Thank you. We appreciate your efforts to streamline and get your arms around all of this stuff. I know it's all just
a lot.
Yes, a lot of questions, and there's been a lot of insecurity and a lot of folks just really needing this information so that they can make plans. So thank you. We appreciate your efforts.
Okay. Thank you.
Thank you. Okay, I think that is all we have for today. I want to make sure the public knows we have been meeting every week now since March, and almost all of our emergency operations have been dialing back a bit, because there's less emerging information. And so next week, which is the Tuesday immediately after Memorial Day, which is a holiday, we will not be having a board meeting. So I just want to make sure the public knows, because people are starting to get in the habit of every Tuesday tuning in. I want to make sure people know that we will not be meeting again until Tuesday, June 9th, and we will be moving into budget discussions in June. So I'm going to turn one last time to the clerk of the board. Is there any comments we need to read into the record now?
Madam Chair, we've received about half a dozen comments, so I'd say about 6 or 7 related to reopening businesses. Would you like me to read those into the record?
Yeah, let's go ahead. If we can read them in quickly, yes. I don't want to short anybody by not reading theirs.
The first comment is from Carol Blevins, who writes, "The state of emergency is over. Americans gladly agreed to stay at home until April 7th, 2020, to help flatten the curve, and again when the shelter in place was extended until April 30th, 2020. The curve is flattened, our hospitals are better prepared, and our knowledge of the virus is more robust. By continuing the shelter in place, you are doing more harm than good. This pandemic is now a manageable level. Based upon current information, the CDC has identified those at high risk for severe illness from COVID-19 are 1, people over 65, and 2, those with underlying health issues. And yet, our elected officials are allowing the shelter in place for those that do not meet the CDC criteria. Yes, COVID-19 is contagious, but we have learned you can recover, including those that are at the high-risk segment. Instead of our San Joaquin County supervisors and county health officials structuring guidelines for opening the cities and counties, it looks like politics, power, and money are the guiding force behind most of these decisions. 20 counties have reported no deaths from COVID-19 straight from the CDC website as of May 7th. Another 25 counties reported less than 20 deaths. Again, this information is from the CDC website as of May 7th. This is a total of 45 of the 58 counties with a minimal health impact due to COVID-19. We will not be asking for permission to exercise our First, Fifth, and 14th Amendment rights. We will open our businesses, play in the park, go to the beach, and if you do not support the will of the people, it's time for us to vote you out of office. The next comment is from Tiffany Panella, who writes, "My name is Tiffany Panella, and I live in Stockton, California. I'm writing this message to let you know that I am in support of opening all county businesses. All businesses should be deemed essential, not just those run by large corporations. I urge each and every supervisor to open the county for business. As a small business owner who has been unable to operate during this shutdown, I know what it is like to pour one's heart and soul into a business only to see it slowly slip away. Our county relies upon each and every one of us and the revenue we generate. We cannot continue the shutdown as it is now. We are seeing our customers being stolen by similar businesses in other counties. We may not recover from that. Once again, I urge you to vote to reopen the county and allow our businesses to operate with the necessary protocols in place, of course." And the next comment is from Jessica Hilscotter, who writes, "Thank you for taking the time to listen to your community as we all are suffering right now. I know most of the letters that are written are for small businesses to be reopened, but I think one of the most important thing that should be talked about more is our children. Our children have been left behind in this whole pandemic. They have been left behind in all aspects, from school, friends, sports, family, and to living a normal childhood. The emotional toll that this has taken on our kids is unfair and unwarranted. They have already had to miss out on an education. End of the year activities, basketball, baseball, cheer, competitions, birthday parties, Easter, and even being able to go to the local park. I work for a hospital in San Joaquin County. When this whole thing started, I was 100% for getting us ready at the hospital, social distancing, and doing whatever we needed to do to get life back to normalcy for my children. Now that the hospitals are empty, staff being laid off, furloughed, people unable to pay their bills, are we really doing this for the better good? What does the county step in, like other counties have, and say this is enough? Another point I want to make, as the Secretary of Lodi Titans Youth Sports, our kids are really looking forward to playing football and cheerleading in August. Our hopes is that San Joaquin County will loosen the restrictions our kids' sports, since we all know sports builds kids' self-esteem, develop teamwork, leadership skills, and develops healthy lifestyle habits. If we can give these kids some glimmer of hope after this devastating last few months, it would mean a lot to me and also to our community. Joseph Helmstead from Linden writes, U.S. Urgent Call to Action, U.S. I am in support of opening all businesses. I want them to declare all businesses essential. I want you to vote to open all businesses immediately. Thank you. Aaron Flores writes, I am a parent who firmly believes that our country should offer an education to our children. We cannot, I definitely close schools because someone may or may not get sick. We all need to wash our hands and stay home if any symptoms begin, and get rid of perfect attendance recognition. Please hear our cry. We care that everyone is cautious, but that our lives do not stop. Thank you. Sally Self of Stockton, California writes, I'm writing to encourage the board to open all businesses in San Joaquin County immediately. We have been practicing social distancing for the last couple of months. We have listened to federal and state officials and followed their instructions on how to flatten the curve. It seems that no amount of social distancing, etc., can eliminate this virus. People are suffering as they have lost their livelihoods. The economy is suffering and may take years to recover. Citizens are being controlled by the government as never before in my lifetime. It is very frightening to see our rights and freedoms violated. So I hope the Board of Supervisors will step up and allow us to use the mitigation techniques we have learned to return to some normalcy, open businesses, and restore our rights and freedoms. Jeremy writes, Board and Public Health Officer Parks. If we can open the malls and dine-in restaurants with social distancing, why can we not push for churches being open as well with the same distancing? I realize, as you've said over and over, you have no control, but can't we request to open those and other things like small businesses early? Isn't that something the governor allowed in his order? P.S. We are still dealing with violations of constitutional rights. Thanks. And then Danica Nosetti also wrote in and says, I would like the board to declare all businesses essential and vote to open them immediately. And Madam Chair, that concludes the comments.
Thank you. Okay, that is it for today. We are adjourned until June 9th at 9 a.m. here in these chambers. Thank you, everybody.
Everything, Mark.
Like, what part of you're on a conference call in the meeting?